Croeso i bob un ohonoch chi i'r cyfarfod y bore yma, sef cyfarfod Bwrdd Iechyd Addysgu Powys. Hyfryd i fod yma, a braf iawn ydi bod efo cydweithwyr o'r bwrdd fydd yn cyfrannu at y cyfarfod y bore yma, ond hefyd efo pob un ohonoch chi sydd yn ymuno â ni ac sydd yn gwylio y cyfarfod yma ar-lein. Ac wrth gwrs, yn ychwanegol, y rai ohonoch chi hwyrach fydd yn gwylio y cyfarfod yma, y recordiad y cyfarfod ar-lein yn dilyn heddiw. So it's wonderful to be with everyone today. A very warm welcome to each and every one of you. Apologies initially for starting a little bit late. We were having some technical difficulties that had to be resolved before we could start our live stream this morning. So apologies for that, but it's good to be here, and particularly welcome to those who will be watching this meeting online, and indeed to those who will watch a recording of the meeting that will be available for people after today and after the meeting. So good to see you. Cael cwmpredwi a fi ydi cadeirydd y bwrdd, ac wrth i ni fynd trwy'r cyfarfod, fe welwch chi ar eich sgrin aelodau yng nghydweithwyr fydd yn cyfrannu at y cyfarfod, ac hefyd aelodau a chydweithwyr sy'n methu bod gyda ni heddiw ac sydd wedi cyfleu ymddiheuriadau am eu hamsenoldeb. As we go through the meeting today, on your screen you will see the names of those who will contribute, and you'll also see a list of members and colleagues who can't be with us today and who have tendered their apologies for absence. Just gair o esboniad o ran pwy ydyn ni, be ydyn ni, ac be ydy ein pwrpas ni heddiw. Y bwrdd ydy corff llywodraethol y Bwrdd Iechyd, ac mae'n cynnwys aelodau gweithredol ynghyd ag aelodau annibynnol. We are a unitary board that consists of both executive members and independent members. And together we are responsible for pooling, if you like, and making sure that our respective skills, experience and expertise support the good governance and the effective governance of Powys Teaching Health Board. Ac mwyn gwneud hynny, ni felly sy'n gyfrifol am gosod cyfeiriad strategol y sefydliad. Dyn ni'n gyfrifol am osod archwaith risg yn gysylltiedig ar cyfeiriad strategol hwnnw, a dyn ni'n gyfrifol hefyd am fonitro ac am graffu ar perfformiad y sefydliad, ein perfformiad ni yn erbyn ein strategaethau a'n cynllunio. Ac yn bwysig ofnadwy, dyn ni yma hefyd i siapio diwylliant y sefydliad, i sicrhau bod ni nid yn unig yn gwneud pethau yn iawn, ond y ffordd dyn ni'n gwneud pethau yn iawn hefyd. So our purpose and our responsibilities today are several. We're here to set the strategic direction of this organisation. We're here also to set the risk appetite in connection with that strategic direction, to monitor and to scrutiny our performance against those plans and strategies, and very importantly, we're here to ensure that the culture of our organisation is as it should be and as it needs to be. In other words, the how we do things is as important as the what we do. And so that generally is our responsibility. I'm not going to go through the agenda in detail today. The papers for today's meeting are available on our website, and please do access them there so that you can follow the papers and the content of the meeting as we proceed through the meeting. Just a word of brief explanation. You may note during the meeting that I and other colleagues sometimes turn our gaze away directly from our cameras. That's really because we're working off multiple screens, and in my case, I have the papers on a screen to my right, I have my agenda on a screen to my left, and the meeting is in front of me. So so please don't think that that we are not concentrating or we're not giving due attention to the meeting. It's just that we're accessing important and necessary information. We have a very substantial meeting ahead of us today with some very important and indeed sensitive matters for our consideration and for our attention. But we will be taking breaks. We will have some comfort breaks and a lunch break as the meeting progresses. So without any further ado, we will move to our agenda, and initially to the welcome and to apologies that which you've seen on your screen. I would like to welcome particularly this morning Mick Janassi, who is a newly appointed member of our board for the next 6 months, appointed by the Minister of Health and Social Care. Mick comes to us with a very distinguished and very extensive professional background in public service and in the governance of public bodies. And I'm delighted that that he's with us, and I know that his contribution will strengthen the effective governance of our organisation, and we look forward to working with him. One of the technical difficulties we were having earlier was actually with Mick's sound, so I don't know whether that's been sorted, but I know that Mick will contribute as the meeting goes on, and we look forward to that. Also, just to say, very hot off the press, as it were, we have Nina Davis with us, who is the associate member from the local authority and the Director of Social Care in the local authority, and the Minister for Health and Social Care has very recently confirmed Nina's appointment to our board for the next 4 years, and we will be confirming that formally, Nina, but certainly informally and publicly, absolutely delighted, and we look forward to building on the good working relationship between the Health Board and the Council, and indeed between you and executive colleagues here in the Health Board. But good to be with you. So, are there any declarations of interest? Unrhyw ddatganiadau o fuddiannau yn gysylltiedig ag unrhyw item ar yr agenda bore yma? Does anyone want to declare any interest in relation to any agenda item on our agenda today? I can't see. Oh yes, sorry. I'm just checking my my chat bed. Yes, Ian, would you like to come in, please?
Yes, just in relation to item 6, the Welsh Joint Commissioning Committee, colleagues should be aware that I chair the Welsh Kidney Network, which is currently a subcommittee of WISC. I don't see that it has any material impact on that, but I think it's important that people are aware.
Thank you, Ian. You're absolutely right. Thank you. It's good to have that declaration, but certainly I see no reason why that should impact upon your contribution to that agenda item if you want to contribute. So, and Chris, please come in.
Thank you, Chair. I wanted to register an interest in the confidential item 7.3, just to note that I am a member or elected member of Powys County Council, so I just wanted that to be noted.
Thank you, Chris. So I don't see any other declarations of interest, so thank you for that. And so we move to item 1.3 on our agenda, and Deborah Wood-Lawson, our Executive Director for Workforce and OD, will present the staff experience story, and I know that she's going to introduce us to Kate. So thank you, Deb.
Diolch, Chair. Bore da, everybody. I'm delighted to welcome and introduce Kate Prothero to the meeting, who will be sharing her staff story with us all today. Kate is a service development manager working in immunisation and vaccination for Powys Teaching Health Board. Kate will be sharing both her career journey and being part of a graduate programme, and more recently her recent success in the Powys Teaching Health Board Staff Awards. Can I hand it over to you, Kate? Thank you.
Hi, morning all. As Deb said, my name's Kate Prothero. I have worked with the Health Board for 5 years now. So after finishing university over 10 years ago, I was offered a full-time role in a community pharmacy where I worked on weekends and holidays. I stayed here for 8 years and qualified as a pharmacy technician, and then went on to qualify as an accuracy checking technician. After my 8 years in community pharmacy, I moved on to working as a pharmacy technician in 2 GP practices across the South Powys cluster. I'd looked at the NHS graduate scheme previously, but had never thought that I had enough experience to apply. But as there were limited progression routes for me in pharmacy, I thought I'd give it a go, not for 1 minute expecting to actually be successful. After the application process and shortlisting for the graduate programme, first there was an assessment day where you had to do aptitude tests, in-tray exercises and a group discussion. I was successful at this stage, and then the next day I did a range of presentations and interviews, one being with the head of Cwmtaf Health Board at the time. I really enjoyed the process, and myself and a few others were successful in getting onto the graduate programme. As a result, I joined Powys Teaching Health Board in 2019 on the graduate scheme, and one of the things that attracted me to the graduate programme, which was run through Cwmtaf Health Board at the time, was that they were offering this to be completed fully in Powys. I already had some knowledge of healthcare in Powys through my previous roles, and I think that by also being a Powys resident, I was more keen to be able to be a part of the services that myself and my family were using. Over the 2 years that I was on the graduate programme, I worked across many different departments in Powys and worked on a variety of projects. The Corporate Health Standard with Occupational Health, the Breathe Well project with commissioning, the North Powys project looking at virtual clinics, and then moving on to the social distancing project with organisational development. And then lastly, in primary care, looking at cluster development and the annual plan. From my experience of the graduate scheme, there were huge positives about working in Powys. And I found that rather than being working as part of a project team, I was given the autonomy and trust to lead on some projects from my very first placement. I also seem to have a lot more exposure by being based in Powys than some of my other colleagues in placements in other health boards. And we noted how visible and accessible senior leaders and especially the executive team in Powys were, and you would often bump into them just walking around Bronthlis. Part of my development on the graduate scheme involved having regular meetings with my executive mentor, who was Hayley Thomas. And it's been really lovely to maintain a relationship with her and be able to keep her updated of what I'm doing in my role. I also had huge support from the organisational development team in Powys, having regular catch-ups with my manager to ensure I was making the most of my placements and the opportunities that were offered to me. When I was on my last placement in primary care, when the COVID vaccination programme was in the final part of the planning phase, and I was swiftly moved over to help with the final stages of planning and the deployment. From there, I have managed to help develop the service from the mass vaccination programme into a more business as usual vaccination service that we have today. I have worked to expand the remit of my role by saying yes to every opportunity that's been offered to me, taking on the management of the booking team, the administration team, and also leading on the planning and project management side of this role. Everyone says that by working in Powys, you wear a lot of hats, and I think that's one of the things I love about working here. Every role in Powys is so varied, and from my point of view, I think there are so many opportunities to develop your role, whereas in other health boards you may be limited in what you can do. The geography in Powys is always one of the challenges, and having teams working in the south and north does stretch your resources, especially being able to offer a service to deliver to the whole of Powys when your funding doesn't necessarily take into account rurality and geography. But this is also an opportunity for us in Powys to work differently and overcome those barriers, which is something that is often taken for granted. And so recently I won the Powys Teaching Health Board Excellence Award for leadership and taking responsibility, which is a huge achievement and one which I'm really proud of. And I just want to say that I was only able to achieve this because of the fantastic mentors and role models that I have been able to work with in Powys throughout my time with the Health Board.
Thank you, Katie. Deb, do you have any additional comments that you'd like to make?
I do, thank you. Thank you, Kate, that was great. And you just referred to role models that have supported you. I think we need to acknowledge that you are also a role model. You're a role model for growing our own, which is something that is really important to us, and also supporting the moves that you've made between teams, between directorates and between professions, showing that actually we can create career pathways that take people in a less traditional format. So I'd like to kind of thank you for all that you've done and all that you've said today, and I think it's an important learning point for the board. So, diolch.
I absolutely endorse all of that. It's been my pleasure and privilege to meet you a few times now and glimpse a little of your fabulous achievements, but also the esteem in which you're held with the colleagues who work with you, and the way in which you've developed your service and the impact that that's had on the health of our Powys population. It's been absolutely inspiring. You mentioned that Hayley Hayley Thomas is your mentor. Whatever's happened to her, I'm not sure, but that support and so on has been tremendous. And what your story today does, it enables us as a board to humanise a lot of the information and data and so on that comes to us through papers. We talk about growing our own, about developing our workforce, supporting people, and so on. You make that real. So thank you very, very much for sharing that with us today. And we certainly look forward to continuing working with you and to you, and to your future development here in Powys. So thank you very much.
Thank you.
So with thanks to Kate, then we move on now to our next agenda item, which is something new to us in Powys Teaching Health Board, a slightly new way of working, known as a consent agenda. And I'm going to ask Helen, our Director of Corporate Governance, just to explain briefly what this is and the reasons for considering adopting it this morning. Thank you, Helen.
Diolch, Carl. Morning, everybody. Helen Bushell, Director of Corporate Governance. So this is an advancement in the way in which we manage and handle our board and committee meetings, fairly routine across other public sector bodies, including NHS bodies. And really, it's a meeting practice that helps us group together all of our reports into one that are either very routine or not contentious. So the consent agenda is really approved as one item, either for approval, for assurance, or for information. And you can see on the slide there, that's summarised into one way. This would always be a very small part of our meeting agenda. And as I said, there would never be anything in here that either wasn't routine or was contentious. If we could just move on to the next slide, please, Liz. I'm not going to go through all of this, Carl, but this just sets out for board members and for members of the public as well, the way in which we would manage the agenda. There are a couple of key points just to raise. So in your role as the chair, Carl, you would, with the appropriate advice from colleagues, decide which items to place on the consent agenda. They would be released to board members well in advance of the meeting. And a really key point halfway down the slide there, if any board member at any time requests that an item be moved onto the main agenda for consideration or for discussion, that would be moved immediately for any reason at all. And I think that's a very important point. So board members will have the opportunity to raise anything onto the agenda in advance of the meeting. They will also have the chance at the beginning of the meeting in case there's anything else that they've considered relevant on the day of the meeting itself. If you just move to the last slide, please, Liz. So just in summary, this is a mechanism designed to help us be efficient with the management of our meetings, make sure that the board has the appropriate time to discuss the most significant and time-consuming items. As I said earlier, all consent items will be routine and non-contentious and therefore not require any significant decision of the board. It's really important, though, that all board members are very clear that the papers do form part of the official agenda, therefore very important that everybody's read and considered them appropriately, and all of those are available in the public domain as always. I'm suggesting that we move ahead with this, but we monitor it very closely. We'll do a review within the first 12 months leading up to March 2025, during which time we can consider how it's working and if it's been effective for us. Thanks, Carl. I hope that's helpful.
That is helpful. Thank you, Helen. Just a point of clarity. We're being asked to agree this today. So if agreed, that will stand for all meetings hereafter. We don't need to agree this at every meeting.
No, this is a principle to agree today for our board and committees, and then the chairs of each of those meetings take charge of that agenda then.
Thank you. Does anyone want to contribute or comment in relation to this proposal? Hayley, please.
Yeah, thank you. Thanks, Helen. I think this is a really helpful step for us, because I think the balance of time and what we spend our time on in this board meeting is really important. But I think the additional check that anything can come above the line, if members wish so, is a safety mechanism, so that we're not sort of putting things through that don't require debate. It's just recognising that we're using the best time on the most important matters for us as a board. So I really welcome it, Carl, and I think the evaluation as we get through the year is just checking at the end of the year, what did we use this mechanism for, and whether we still feel comfortable that that's the right approach as a board. Thanks.
Thank you very much, Hayley. So I can't see anyone else coming in. So the proposal today is that we agree to operate a consent agenda. As we often do, if you don't support that proposal, would you please indicate? No one is indicating, therefore that proposal is supported unanimously. Thank you. So we move to 1.5 on our agenda, which are the updates from myself, the Vice Chair and the Chief Executive. I'm going to take my report as read, but I do want simply to give voice really to my and our delight that Hayley Thomas has been appointed as our substantive Chief Executive Officer. Of course, we've known Hayley for some years, and also we have benefited from her recent contribution as interim CEO, we certainly look forward to Hayley leading the operational delivery of this organisation in the creative, effective and impressive way in which she carries out her responsibilities. So Hayley, absolutely delighted, llongyfarchiadau ac yn sicr mae pob un ohonon ni yn edrych ymlaen at gydweithio efo ti i'r dyfodol. Felly, da iawn, gwych. But just with that one additional comment, I don't have any other additional comments. Would anyone like to discuss any item on my report? No, so we go then to Kirsty and to the Vice Chair's report. Any additional comments, Kirsty?
Bore da pawb. No, Carl, I'll take the report as read, but happy to respond to any queries, questions or comments from colleagues. Thank you.
I'll pause to give people an opportunity to come in on any aspect of Kirsty's report. No, so we move to Hayley's Chief Executive report. Any additional comment, Hayley?
Most of the report is read. Just to highlight 2 points really. The junior doctor industrial action, just, you know, the impact this is having in terms of the planning and requirements, particularly for our neighbouring health boards, is substantial. And obviously this industrial action plan for next Monday, leading up until Good Friday. And I think that just to reference that this work is ongoing, and in particular the impact on flow and the need for us to work together with social care partners to make sure we're supporting the district general hospitals during this time is a continued focus for us as a health board. And then just one other point just to highlight in the report is really the content regarding the really substantial amount of work that's been led regarding the Belmont branch surgery work associated with that, and just to bring that to the board's attention that substantial progress has been made, and we're moving that to business as usual arrangements during this next period. So those are the 2 points I wanted to particularly highlight. Thanks.
Thank you very much, Hayley. Chris Walsh, please.
Thank you, Chair, and thank you, Hayley, for your report on the. I'm the independent member with local authority on the. I just wanted to pick up in relation to the MMR response, and I just wanted to see if whether aren't the numbers in Powys increasing up, and is that the reason for our response going in, or is it in a proactive nature to address this important public health issue, because it's really important that those of eligibility for this vaccine do take advantage of it. And I just wanted to stress that message, because my background is within health visiting in the past, and I've been encouraging people over many years to get that vaccination. So it was just on that I wanted to understand that little bit of the background. Thank you.
You're on mute, Hayley.
Hayley.
Mez will come in, Chair.
Yeah, diolch. Thank you, Bore da, Meredith Bowley, Director of Public Health. Thank you, Chris. It's an important area and to draw focus to. So we've proactively stood up a group involving partners across Powys in light of numerous outbreaks of measles in areas of England, and obviously across our border in Midlands as well, and before Christmas in Cardiff. So there's been proactive work going on for the last 6 to 7 months to drive up MMR rates. So we do have fairly good rates in Powys, but we are mindful that individuals may have missed if for some reason. So we're doing targeted actions with children up to 16 years of age to highlight to parents that if their child has missed for any reason, that we can do drop-in through our centres, and obviously distributing information out to schools as well. So happy to provide further information as well outside of the meeting if that were helpful. But thank you.
Thank you. Chris,
Thank you.
Is that okay?
Yes, that's fine. Thank you very much.
Thank you. I can't see anyone else wanting to respond to Hayley's report, so thank you, Hayley. And we move on to item 1.6 of our agenda, ac dyn ni'n troi yn sylw at waith ein pwyllgorau, a dwi am just bwysleisio mewn gwirionedd y pwysigrwydd ac arwyddocâd ein pwyllgorau i ni fel bwrdd. Our committees as a board are of crucial importance. They do the real detailed scrutiny in relation to a lot of the information that comes to us as a board. And so we rely on our committees to do that detailed work, and indeed we rely on the chairs of our committees to be that key source of assurance to us as a board that that careful challenge, that careful scrutiny has actually taken place. So therefore, we as a board don't need to duplicate that or replicate it, but we look for that source of assurance in terms of our decisions within a board setting. So with that in mind, we're going to go through the committees, and I'll invite the chairs of each committee to speak to the papers and to draw our attention to anything that needs our attention today. So we go firstly to our Patient Experience, Quality and Safety Committee, and to its chair, Kirsty. Thank you, Kirsty.
Thank you, Carl. Hopefully the paper supplied by the PECS committee is straightforward. There is one item that we would like to bring to the attention to the board. Previously, the committee has brought to the board issues around infection prevention and control, as we felt that this was a corporate responsibility, not just a responsibility of the individual committee, and that every colleague should be cited on it. You will see from the report, we are 1 year, the committee at its last meeting received a report of the implementation of the Infection Prevention and Control Improvement Plan. We are 1 year into that plan, and we were very pleased to hear of the significant progress in implementing the actions of year 1 of that report and plan. And we wish to bring that to the attention of the board, of the good progress that has been made in this last year, and that we are satisfied that as an organisation we have a comprehensive system for addressing infection prevention and control issues via the plan, and that we will continue to scrutinise its implementation as we go forward. But I'll take any questions or comments if people have them.
Thank you, Kirsty. Does anyone have any comment, question or contribution in relation to the PECS report? No, thank you. So we go on to the Exec Committee's report and to Hayley.
Yeah, good morning. Right, okay, so this report covers 5 meetings of the Executive Committee, and you can see the breadth of issues that we've covered, many of which have gone forward to board committees for assurance and consideration. We continue to have a substantial grip on quality, finance, performance, risk management and other workforce matters. And some of the key matters I draw to your attention that haven't been considered by other committees include some organisational policies, both staff and operationally focused, the Welsh language investigation and response to the Welsh Language Commissioner, where we continue to work towards the Welsh language being treated no less favourably and have made some really positive steps, and a deeper focus on nationally reportable incidents and incident management. We've also been looking at our quality governance structure, and the board will see later on the agenda today the integrated quality and performance framework revisions. So thank you, Chair. Happy to take your questions.
Ronnie, would you like to, yes, Ronnie, please.
Thank you, Chair. That question was actually raised in relation to a previous agenda item, so I have no question.
You've suddenly gone on mute, Ronnie, so we missed the second half of what you said, but
Thank you. Just to clarify, Chair, my question was in relation to a previous agenda item, so it has no relevance at the moment. Thank you.
Okay, thank you very much. Robert, do you want to come in on this, or? No. No. Okay, that's absolutely fine. So I can't see anyone else that wants to respond to Hayley's report. So thank you for that, Hayley. Appreciated as always. We go now to the Audit and Risk Committee and to its chair, Robert Lewis. Thank you, Robert.
Thank you, Chair. The 16th January meeting was summarised orally at the January board, so that summary is provided for completeness. I want to make some comments about the 11th of March Audit, Risk and Assurance Committee meeting. Firstly, the audit certification deadline, which is the audit of our accounts, will be completed by the end of June. The structured assessment by Audit Wales, this is quite a large and important document. It's involved many people in the Health Board, and it confirms overall a largely positive and maturing picture of this Health Board as an organisation. The internal audit plan for 24-25, there are about 30 audits and follow-ups planned. An interesting side discussion ensued about the balance to be struck between the number of audits, the time taken by Health Board staff in informing these audits, and the cost of these audits. And the position is that the committee will continue to expect the executive to balance all these factors against the added value achieved, and this might mean a considered reduction in the number of audits next year. We'll see. Of the 5 internal audits reported to the 11th of March meeting, only one was of limited assurance, and this was related to our capability to keep our ageing estate in good condition. Whether it's comfort or not, this is an outcome shared by all health boards within Wales. And lastly, the committee received an update on the board assurance framework, which has been mentioned in the structural assessment and also by other bodies outside. Some really good work going on this, and our thanks to those who have got it into the condition it's in at the moment. A little bit more work, and then it'll be presented to the board at a later date. Thank you, Chair.
Thank you, Robert. Again, I'll pause to leave time for any contributions from colleagues. No one wants to contribute, but thank you, Robert, and as always with all the committees, thank you to committee colleagues for that detailed and important work that is carried out, that we receive, as I said earlier, as a source of assurance. So we go now to our Delivery and Performance Committee and its chair, Ronnie. Please, Ronnie. I'm sorry. I'm sorry. Please forgive me. I've skipped one of our committees, and we're sticking with Robert because Robert also chairs our Planning, Partnership and Public Health Committee. Forgive me, Robert. We're back with you.
I thought I got away with it then, Carl, but no. This is the 20th of February meeting. Now, the social economic duty report is considered elsewhere. We did consider it at that meeting, and the diabetes deep dive will be reported in the months ahead. So I'd only like to pick out one item. And the committee's independent members have always taken a great interest in endoscopy services, partly because these are often provided by this health board itself. And we received a very detailed and very timely report on both endoscopy and bowel screening services. And bowel screening is also an example of unintended consequences, and we sometimes find this in health. So from October of this year, screening will be rolled out to 50-year-olds, which is clinically desirable, but there are already delays in receiving the results of analysis from partner health boards. And so this expansion will put more pressure on the system. We will continue to follow this closely, but I thought it was an interesting example of whether good intentions, if you like, can create temporarily, we hope, further pressures in the system. Thank you, Chair.
Thank you, Robert. And again, does anyone want to comment on or ask a question about the report from our PPPH committee? No? So thank you very much, Robert and colleagues, for that work. Just before we move to DMP, our delivery and performance, I just thought it might be worth highlighting the inclusion in our papers of our structured assessment report, and colleagues and indeed others will have had the opportunity to read that. Clearly, there are recommendations in that report for improvements and for strengthening, and we will certainly take those recommendations and act upon them in order to continue our journey of improvement as a board. But equally, we take a lot of affirmation from that report in relation to the way in which we continue to develop and strengthen the governance of Powys Teaching Health Board and the direction in which things are travelling. So I just wanted to particularly highlight, as it were, the importance of that and additional paper supporting the ARAC report. But with no further ado, we move on now. We do go to Ronnie now, Chair of our Delivery and Performance Committee. Thank you, Ronnie.
Thank you, Chair. Just to reference that a 10-page report has been tabled, and I think that gives some idea of the volume of business going through the committee. I have extended the timings for this committee temporarily, I hope, in order to ensure that we do have adequate discussion of our substantive agendas. Just to reference the fact that we discussed finance particularly, and that was the month 10 report. The committee took assurance that appropriate reporting mechanisms are in place and discussed the forecast for 24-25 and the underlying deficit, which remains on track to meet the control limit of 12 million. We also discussed the integrated performance report, the annual delivery plan, and for the first time, the annual health and safety report. And I think at that point, Chair, I will pause, but I'm very happy to take any questions or observations. Thank you.
Thank you, Ronnie. Are there any comments, questions, observations for Ronnie and for the D&P committee? No, so thank you, Ronnie. And as you noted earlier, a huge amount and a huge volume of work goes through the D&P committee, it does take a lot of time, effort, attention, and so on. And so thank you and to colleagues for that. We turn now to the charity committee, which I chair. I don't have any additional comments for most of the report. That is there for people's information. I think it's worth just noting, and Pete, our Executive Director for Finance, may want to comment as well, but it is unfortunate that although we submitted our annual return to meet the deadline of the 31st of August, we haven't as yet been able to upload our annual accounts and report as a charity because we're still awaiting required assurances from our investment managers. But that is in hand. It is being dealt with, and we have been working with Audit Wales to make sure that that things are resolved and things move on quickly. But Pete, do you have any additional comment you want to make in relation to that, or indeed in relation to anything on this report?
Nothing really to add. Thank you, Carl. Just to say that a number of the health boards are in a similar position to ourselves. It's in relation to assurance that Audit Wales are looking to receive from our investment fund managers. There's no issue around any sort of materiality of financial detail, but it's that assurance they're looking for in relation to their systems that they use.
Thank you, Pete. So does anyone want to ask a question or comment in relation to the charity report? So certainly not least, but finally, we turn to our Workforce and Culture Committee and its chair, Ian Phillips, although Ian was having a wonderful holiday, and another colleague, Jennifer Owen-Adams, actually chaired the last meeting, but Jen can't be with us today, unfortunately. So over to you, Ian.
Yes, thanks, Carl. I'll take the report as read. As I say, I can't comment in detail because I wasn't at the meeting, but I would like to highlight a couple of things, if I may, just in terms of our sustainability and growth as an organisation. So the Aspiring Nurse programme, our approach to growing our own workforce, I think, is starting to show the signs of success. And I think we'll speak more about that as we go along. Something that we are very pleased at the progress. I'm also pleased to note that we are focusing in the committee on the staff voice and looking at our processes, including chat to change on that. And as Ronnie also said, finally, we're looking at extending our timings so that we make sure we have sufficient time to go into the detail. In respect of today's agenda, just wanted to point out item 3.2 and 3.3, which is the strategic equality plan and the Welsh language strategy in healthcare. Both of those things were considered in detail at that meeting and are on the agenda today for further consideration later on in the agenda. Thank you.
Thank you, Ian. So again, please do indicate if you'd like to contribute to this item and respond to the W&C report. Nobody's indicating, so again, Ian, committee colleagues, a big thank you for all that detailed work, much appreciated. The recommendation is that we receive these summary assurance reports as a source of crucial assurance that we as a board are fulfilling our roles in relation to reporting and monitoring. So please indicate if you don't support that recommendation. So that's supported unanimously. I should say as well that as we go through our agenda today, a number of the papers that we will be considering have already been considered in detail by our committees. And so when we come to those papers, I will turn initially to the chairs of those committees, as I said earlier, as that source of assurance, so that we don't need to repeat the work of the committee, but we can build upon it and enhance it and make sure that we as a unitary board are assured that things are as they need to be and should be. So I will turn to those chairs in due course. So we go on now to section 2 of our agenda, and initially back to the consent agenda business. As Helen helpfully explained earlier, the way in which the consent agenda operates is that those items that are considered as included in the consent agenda section are there because we don't think they need discussion or attention by us in particular today. But I pause now to give anyone the opportunity to say that those items that are included in our consent agenda for today, if you think that they should come above the bar, as it were, and that we need to discuss them. Ian, you would you like to come in on this point?
Yeah, I just had a question in regard to the joint working papers. I think I don't know how you want to play this now. Do you want me to ask the question now, or do you wait and shall we wait until we get to that on the agenda?
Helen, can you help it? Because when we come to that on the agenda, anything in that section of the agenda, I'm assuming doesn't need conversation or discussion unless we bring it above the line.
That's right, Carl. I would suggest that Ian just identifies now, as he has, the item that he wishes to raise on the partnership agenda, and then when we get to number 5, we'll take the other 2 as consent agenda items, and at that point we will raise Ian's query above the line to consider it.
Happy to do that now, Chair.
Yeah.
I just think it would be helpful.
Sorry, Ian. Sorry, if I understand Helen correctly, so we'll discuss that when we get to that item. So Yeah, is that okay?
Yeah, that's great. Thank you.
Lovely, thank you. So I can't see anyone else indicating that they want to, if you like, raise anything outside of that consent agenda. So we'll move on to item 3.1 of our agenda and our items for approval, for ratification and or for decision. We go to a very important matter, lots of important matters today, our plan for the next strategic period, our integrated plan for the next 5 years. And I'm going to ask the Chief Executive, Hayley, to begin introducing this item. Thank you, Hayley.
Oh, thank you. Thank you. There are several of us going to present this plan to the board today, and my intent is to cover off in a summary at the end, if that's okay. But obviously it's a requirement for us as a health board to submit an integrated medium-term plan to Welsh Government by the end of this month, and this summary presentation draws together the key components of our plan. So if it's okay, I'll hand over straight away to the team to present. And first, Stephen, if you'd like to come in, thanks.
Thank you, Hayley, and good morning, everyone. I'm Stephen Powell, Director of Planning Performance and Commissioner at Paris Teaching Health Board. Within the board pack itself, you will find a formal paper that describes the process of the integrated plan, and also the actual plan itself that is quite numerous in pages. So what we've decided to do is prepare a presentation to draw out the key themes of the plan and the way it has been produced. So myself and other colleagues will be delivering this presentation. Next slide, please. So we've decided as a health board to do a 5-year plan. Typically within health boards within Wales, a 3-year plan is produced, but we've decided to do a 5-year plan so that we can address some of the challenges and changes and that we need to as a health board. The plan covers the entirety of our responsibility, both as a provider and a commissioner, and we've also clearly had to make inclusions for the NHS Wales planning framework. And the plan itself responds to one of the most challenging periods in the history of the NHS, and in these early years in particular, it's not been possible to identify a break-even plan, and Pete, the Director of Finance, will discuss that later on in the presentation. We are striving, though, to strike a balance of risk across the various domains of quality, performance, finance, workforce, quality, so that we balance that risk correctly across those areas. And we spent a lot of time as a board and as an organisation debating those areas to make sure that we do achieve that right balance. So we feel that this is our best offer as a health board at the current time, with the resources that we've got to try and deliver those aims. And the plan also sets out how we will work with other stakeholders within Paris and further afield to make sure that we've got a sustainable future. Next slide, please. So the key components of the plan are captured in the graphic on the right hand side, and it builds on previous versions of this plan where we've embedded a healthy care in Paris as a way forward for this health board. So the plan comprises 4 wellbeing objectives, and they're listed there in colours on the left hand side, and it also describes our strategic priorities that underpin each of those objectives. And within the plan itself, you will find firm deliverables as we seek to deliver that plan, particularly in year 1, which is the new financial year coming up. There are 4 supportive enabling objectives across workforce, digital innovation and transforming in partnership, as we recognise that those are key pillars to enable change within the health board. And finally, but by no means last, quality. We've tried to include that as a golden thread across the whole of our plan. There's increased focus by Welsh Government and the NHS in general on quality and the duty of quality. And one of my colleague Claire Roach will discuss that a little later in the plan. Next slide, please. So in bringing the plan together, we've examined a lot of strategic drivers that are driving both the need for health, how demographic changes are evident within Powys, and also in terms of disease prevalence and the future prediction of health requirement. We've built those into the plan when we've been shaping our thoughts and thinking and delivery. We've also started a piece of work in Paris, which we've called our Accelerated Sustainability Model, which aims to rectify some of our issues around service sustainability, workforce, and that's also quite prevalent in our plan in terms of the way we want to conduct this plan over the next 5 years to address our challenges. So we will be working with stakeholders within Paris and outside of Paris, with Paris County Council. We've recognised that there may well be a conversation with trade unions where there are any impact on staffing, but there will be quite a difficult balance to achieve in terms of making change through this time period that we've identified. And so just to reiterate, we have considered that balance that we need in our plan as we move forward over the next 5 years. Next slide, please. This slide focuses on all the external planning requirements that the NHS and Welsh Government require of us. And I won't go through them in detail, but they are comprehensive in the number of requirements, reflecting the complexity of the NHS. I would draw colleagues' attention to the 5 bullet points on the left-hand side in which are ministerial priorities for 24-25 and beyond. They are quite broad in nature, but they do cover the majority of the services that we provide or commission. So a lot of time will be spent in the monitoring and delivery of those. They are quite clearly important targets and that we need to address. Next slide, please. So in terms of the plan development and moderation progress, there's been 3 main phases. So on the left-hand side, this slide depicts the strategic framework, the starting point for the plan. We didn't want to rewrite history in terms of what the Health Board was trying to do. So those bullet points capture some of the influencing factors on that strategy. This year, as in other years, we've also had to undertake a technical exercise so that we're clear what our plan outputs are in terms of finance activity, performance and progress against the current plan. We've refreshed our strategic priorities and we've developed a set of assumptions with trajectories that underpin our analysis. And that technical work is really important to sit alongside the narrative of our plan, because the technical work will form part of the measurement of the delivery of our plan going forward. And on the right-hand side, there has been some moderation, both at board level and with executives and within the operational and management team, so that we come up with the right plan for the Health Board. Within the detailed plan itself, you will find that at the end of each objective, clear deliverables with intended impact and outcomes. And the narrative across the bottom just describes how we have developed this plan across the last 7 months, who we've developed it with, and again, to strike that balance. Next slide, please. And I'm handing over to my colleague, Claire Roach. Thank you.
Diolch, Steve. Bore da pawb. My name is Claire Roach. I'm the Director of Nursing and Midwifery. So as Steve rightly pointed out in the introductory slides, quality is a real focus for us in this plan, and we are really aiming to ensure that quality is a thread throughout the plan. And on the right-hand side of this slide, you will see the infographic that describes those quality standards, and throughout the document you will see that we make reference to the quality standards of safe, timely, effective, efficient, equitable and person-centred care. And that also we have a real focus on what the enablers are to be able to deliver care that is based on those quality standards. So really important what we are doing in relation to our workforce and our culture and our leadership, and clearly the work that is being led by colleagues throughout the organisation, and really important to be able to focus both on learning and improvement and research and information, and you know, critically a whole systems approach. And what Steve was talking about there in terms of our partnership with our local authority colleagues, our work on Better Together, that whole system approach absolutely drives the quality standards. Critically, later on in our board day, I will be presenting with Steve the updated integrated quality and performance framework, previously known as our integrated performance framework, and that work will be pivotal in enabling us to have a vehicle within the organisation in which we are embedding quality as a golden thread. Thank you, Steve.
Thank you. Next slide, please. So this slide focuses on some of the performance trajectories and aspirations that we've developed for the next 5 years. So on the left-hand side, we've just noted some of the assumptions and risks that we are aware that exists at present. So things like industrial action that Hayley referenced earlier. And the chart on the bottom left-hand side of this slide shows our predicted performance for the 24-25 new financial year, year one, in other words, of our 5-year plan. And whilst we've currently got some underperformance within some of the targets within our own provider arm, we aim to be fully compliant with those access targets during next financial year, with the exception of the final one, which is the number of patients waiting 100% beyond their recommended date for a follow-up outpatient activity. We will continue to improve that position, but at the moment we're flagging potential non-compliance with that target for next year. The top right-hand side describes our performance across a broader set of provider activities. The first two columns show the planned performance for the current financial year. The second column along shows the forecast outturn position for the current financial year. And then the three columns to the right-hand side show the predicted performance for year one of our plan, and then year 2, 3 to 5 onwards in those respective columns. So what we're predicting, what we've modelled, what we've included in our workforce and finance plan is enough resource to deliver that expected performance for the services that we provide within Paris. In the bottom right-hand corner are the performance predictions and assumptions for services that we commission out of county, and that's from our network of providers across England and Wales that support Paris residents, particularly in a district general hospital style care, so emergency activity, cancer care, consultant-led referral to treatment time activity, inpatient care, and so on. Now, because of the challenges with access targets in those larger district general hospitals, we are not as confident that performance will be improved in year one, because we've not seen that performance being delivered in the current financial year. Having said that, we are yet to receive those plans from our network of providers at the current time, so I'll be bringing an update early on in the new financial year when all of those plans have been received and reviewed. Next slide, please, and I'm handed over to my colleague, Deb. Thank you.
Thanks, Steve. So just a bit around workforce. So we know that it's well trailed about the shortages of workforce, particularly around clinical and specialist roles, and we know that we're experiencing those within our services. Within our plan, our focus will remain on our priority areas, so transforming and sustainability of the workforce, great place to work, staff health and wellbeing, and working in partnerships across our Workforce Futures programme. So for us, there'll be an intense focus on growing our own. We've heard a first-hand experience earlier. So whether that's for our existing staff, but also our internationally educated nurses and any other professions. Linked to this work is our work with the schools, where we're promoting and allowing an immersive experience into careers in health and social care. So we're bringing through the next generation. We need to ensure that we have the right engagement with our staff and they have the right experience, and that their experience of working in Powys Teaching Health Board is that we're an employer who listens and responds to what it is that they're telling us. We know that we need to transform our services, and we'll do that in partnership with our staff, our trade unions and our partners. We need to maximise the opportunity of digital solutions to automate some of our transactional processes and create new roles and new career pathways. And we need to make sure that we have the full range of staff health and wellbeing options available to those who need support and advice at various points in their career. Thanks, Steve. I think I'm handing on to Pete.
Yeah, good morning, everyone. So just to pick up on the financial aspects of our plan, there's a significant financial challenge and we're unable to deliver a balanced plan to meet the 3-year break-even statutory duty. The key assumptions have been tested and considered by the board. That's taken place over the last 6 months as we've worked up our plan. And as you can imagine, given the financial challenge, there's been a lot of time spent on scrutinising our assumptions around inflation, around growth, and on our ability to mitigate some of those pressures and to deliver savings. The organisation submitted an AO letter in February to outline to Welsh Government the challenges that we face, and the response to that letter has been fully considered as we continue to develop our plan, and the financial plan that supports the plan. So our plan for 24-25 has a deficit of 24.95 million. That is made up of a starting point of an underlying deficit of 25.4 million, an assessment of growth and inflation in the year of 17.4 million, and then an offset of funding from Welsh Government that's been netted off at 10 million. What this means is for the organisation, we need to deliver 7.4 million just to maintain our underlying deficit at 25.4 million. What we have done for our various work with the Opportunities Group is identify a savings target or a mitigation target of 7.9 million. This is 2% of our total spend, and that delivery of that plan would give us an overall deficit plan of 24.95 million. Obviously, a very challenging position. There will be an ambition of the board in year to look to improve the financial position further, look for other savings opportunities and other areas where we can look to reduce our spend. And one of the key actions is to identify the time frame and the actions needed to bring us back into a balanced position, and that links into the overall plan as Steve outlined in our 5-year plan. So very challenging position, but in the aim of our sort of best offer to maintain that balance across the areas that Steve outlined, we've got a financial deficit plan of 24.95 million. Thank you.
Thank you, Pete. So this slide covers our relationship with Welsh Health Specialist Services Committee. Board members will be aware that this committee, as well as the Ambulance Committee, EASC, discharge part of our commissioning functions on our behalf. There was a meeting yesterday where that component part of the plan was discussed, and there is a governance mechanism by which this committee and the EASC committee then feeds into our overall plan, so that we capture the decision making that they make on our behalf into our overall plan as we submit this plan at the end of March. So the meeting yesterday covered those following points on the left hand side. So a request was made for a 4.45% uplift for 24-25 when compared with 23-24. The uplift had been reduced from an earlier iteration where an uplift was of 6.37% was requested. Now, both of those percentage uplifts are higher than the funding settlement of 3.67% that we've received as a health board. So there was some concern and quite comprehensive discussion yesterday in the committee, and some of the main themes that come out of that discussion are captured in those 4 bullet points on the left-hand side. So discussion around service fragility, sustainability with some services, some quality concerns and outcome issues, the need for a longer-term strategy to get specialised services on a more sustainable footing, and the need to monitor the ongoing application of that 4.45% uplift so that it's delivering the desired outcomes. On the right-hand side, that captures the actual decision made that we'll need to import into our final documents being submitted to Welsh Government. So the 4.45% was approved by health boards yesterday, but it is conditional upon those 4 items that are described below. So and those comprise of another review of the policy choices being made, a reconciliation of a fund of 13.8 million that's been included in the financial projections required for WISC, and that's based on rolling forward a funding assumption whereby that capacity was not delivered in 23-24 due to capacity constraints, so that the capacity modelling will need to test out whether that is achievable to be delivered in 24-25, given it wasn't delivered in the current financial year. We agreed some timelines to get those 2 items above agreed at the next joint committee meeting, and the aspiration therefore is that the 4.45 will reduce to 3.67, but clearly as a result of those 2 pieces of work. And the 4th one is that a finance subgroup be formed to both review contract prices and allocation going forward, with the potential to what's known as rebasing contracts for the 25-26 year onwards. I'm going to pass you on to Helen, please. Thank you.
Thanks, Steve. Morning again, everybody. So just a quick overview from the context of governance and risk. As we all know, and is continually the case, risk management and effective risk management is very integral to the delivery and indeed the creation of our plan, and risk management itself forms part of our board assurance framework that, as we heard earlier, we're just moving to a point of nearly being ready to finalise, ready for the next board meeting. The board, as you know, has a key role in setting out the risk appetite for the organisation, and you can see a summary of that on the right hand side of this slide. And for the May board, when we bring through the more detailed annual delivery plan, we will also present back to the board a revised risk appetite based upon some board development conversations that we've been having, and also the continued development of our corporate risk register. I'll hand over to Hayley. Thank you.
Oh, thank you, everybody. As you can see, it's a substantial presentation, quite a complex set of information to present. So this slide really summarising the key points that colleagues have taken us through. And before I summarise, I think the collective efforts that we've made as a board in developing this plan together across the wider organisation, but also the importance of how this fits across the whole system with our partners, is a key part that I wanted to share, that this has been a substantial amount of work and effort for everybody to get this plan to the position that we're presenting today. So just in terms of summary then, the first point is that the plan sets out that £24.9 million deficit in 24-25. So clearly for us as a board and myself as accountable officer, this does not meet the statutory financial duty to break even over a 3-year period. And, I think it'll be very important that we do find a route map to get to financial sustainability and balance as part of our thinking and work over the next year. Quality standards, and Claire's presentation is key. You know, quality has got to underpin safety, effectiveness, timeliness, efficiency. All of the core principles in the duty of quality has got to be fundamental to our plan and balanced against planning, service, workforce and financial considerations. You heard from Steve that as a provider, we're forecasting to deliver against the NHS Wales performance requirements by the end of next year and maintain compliance thereafter. But clearly the challenging position that our commissioned services are facing, given what we already know and the fact that we will need to do the analysis on their respective plans, because we're all submitting at the same timescale to Welsh Government by the end of March, we'll need to do further analysis around our confidence assessment for commissioned services around delivery against key performance targets. I think this plan signals quite clearly that the level of challenge that we're facing as an organisation, and in particular when you layer the demographic strategic drivers that we're dealing with, the population changes and also those quality factors alongside the workforce issues and finances, we will, and we've signalled very clearly in the plan, the need to have a conversation with all of our partners across the system and the public about the future shape of services that we can sustain in Powys. And on that point, Chair, I wondered whether, I know Kate Wright, our Medical Director, and Mererid Bowley, our Director of Public Health, wanted to make just a couple of points around that particular issue, if that's okay. So shall I ask Mez, would you like to come in first about the your points, and then hand over to Kate? Thanks.
Yeah, diolch Hayley. Mererid Bowley, sorry I'm a bit croaky, but so I just wanted to highlight really that the last sort of census, which was published in 2021, showed that although the total population in Powys had remained the same at around 134,000, the population is ageing. And then when we look forward, so over the next 10 to 15 years, this trend is set to continue. So the population projections predict that 1/3 of the population in Powys will be aged 65 years and over, with a decrease in the proportion of a working age, those who provide the health and social care. And as people live longer, they develop chronic conditions or long-term conditions, we also refer them to, such as diabetes, chronic pain and so forth. And the number of adults in Powys living with chronic conditions is projected to increase as the population sort of ages. So it's important really that I feel that we need to act now to support sort of working age adults to be as healthy as possible into older age. And then when we develop sort of chronic conditions, that we support those with chronic conditions to manage these well and to live well with illness and to reduce the impact of illness on quality of residents' lives. So to meet the needs of the population, we need to look at how we deliver these services to meet the third of the population will be over 65 in 10 to 15 years time. Thank you. Diolch, Hayley.
Thank you, Mez. Kate?
Yeah, thank you and good morning everyone. Kate Wright, Medical Director. So really just to add to what Hayley had said, then there's been a lot of thought throughout this. We have a real ambition to provide and deliver as much of the service as we safely and sustainably can in Powys. And so a lot of thought has been put into in terms of continuing and expanding what we do now and further developments as to what we can do optimally, really what we can optimally do with the staff we've got, with the resources that we have, and how to get our staff working to the top of their licence, to support them in training to deliver as much as we possibly can. In that though, we do have to, the challenges are rurality and our small patient numbers, so we also have to be really cognizant that we need to make sure that we have the really important critical mass of patients that we need for our staff to maintain their skills, which is really, really important. And so the other area we've also been looking at is just looking to see, in terms of areas of impact, then which specialties and which conditions we can really focus on, which will have the most impact and give the best health benefits right across the system. So lots of conversation and lots of discussion about how really to have the most impact for our resources and how to support our staff give the safest and most sustainable service they can.
Thank you, Kate, and thank you, Mez, for that, because I think our 5-year plan sets out really a number of those challenges and opportunities. As we've spoken before, this next year is pretty well defined, but signalling very clearly in this public board meeting today that working alongside first our frontline staff and clinicians and professionals, not just within the health board, but with local authority colleagues, third sector and other stakeholders, as well as the public and our neighbouring trusts and health boards, we will need to work very carefully over the next few months to engage on better together and how we can develop that sustainability route map, as it's described, for getting through the next few years. On a very practical note then, just in terms of next steps, we have to submit this plan by the end of the month with the associated technical appendices, which Stephen referenced, and alongside that, this will trigger an accountable officer covering letter if the board is approving it today, because clearly we're not meeting our financial duty to break even. Then we will be expecting during the first quarter of the financial year, April to June, some further discussion and dialogue with Welsh Government to have feedback on our plans, and we'll undertake that assessment of our commissioned services by reviewing our neighbouring health boards and trusts plans. But importantly, it's really important for us in our May board that we sign off our objectives and what we're delivering for the population of Powys in our annual plan, and then that will translate not just to directorate level planning in the organisation, but also to individual performance meetings, performance and development meetings that we hold with individual staff members. So I apologise for taking a bit of time, Chair, because there's a lot in this, but I thought it was really important that we take the board through this plan step by step, and happy to take any questions you may want to cover.
Thank you, Hayley, and please don't apologise. I think that was an absolutely wonderful collaborative presentation of a huge volume of complex information. So thank you, and thank you to colleagues for that. Just before I invite others to contribute, I just thought it might be worth my just stating publicly that that we've been very involved in the development of this as a unitary board. I mean, clearly we rely on and appreciate the professional input, guidance, advice, information of our executive colleagues. But equally importantly, it's about the whole board, execs and independent members. And I think Pete said in this item earlier that I think for the last 6 months or so, we've been closely involved, all of us, with the development of this plan. And it's been a very iterative process. And so a lot of discussion, a lot of scrutiny, a lot of appropriate challenge has been made to get us to where we are today. And also, just for clarity, and Hayley, do comment if you'd like to. So quite rightly, we're not able to meet our financial statutory duty in relation to the balanced plan, and therefore we are technically not able to submit a supportable 3-year IMTP. And so in effect, we will have to submit an annual plan. However, because of all the reasons that exec colleagues have said, because we are in the business of putting in place our route map to sustainability based on quality and safety, we are proactively putting in place a 5-year plan in order to get us from where we are to clearly where we need to be and where we want to be. And so I just thought it was worth just offering that additional observation from my perspective as chair. And with that, then let me go initially to Robert and invite your comment, Robert.
Thank you very much, Chair. I've got 2 questions. First of all, to say that huge amount of work has gone into this, and I appreciate the uncertainties as well in the background. Nevertheless, we've had to create this very sophisticated plan. So my first question is about SP3, which is improve access to primary and community care. And the plan includes working with patients on the perception and experience of access. Now, there are lots of concern from the public, lots of reports, lots of organisations highlighting concerns. This is a 5-year plan. We work in the land of urgent things, but is the executive able to assure us that this important work, this engagement, this precursor, if you like, to action, will be brought to fruition sooner rather than later in this cycle? So that's question 1. And then question 2 is really about SP9, which is urgent and emergency care. I think members of the public will welcome the clarification of the plan, what the future will look like. Primary care, out of hours, including pharmacy, enhanced MIU provision at the 3 regional centres and so on. Just wondered how realistic is it to achieve this within 5 years? Thank you.
Hayley, would you like to respond to that now, or shall we take a couple of comments?
What would be helpful if we could gather the comments? It will give colleagues a bit of time. I was going to ask Pete to pick up on the primary care point, and in terms of urgent and emergency care, either David or Kate perhaps might like to come in on that. Thanks.
Okay, so we'll go to Kirsty and then to Chris, and then we'll come to Hayley and colleagues for responses. Kirsty, please. You're on mute, Kirsty.
Apologies. Can I just say thank you to the colleagues who've put together this plan? It has taken a huge amount of work to do it. It's comprehensive, detailed, and I'm very grateful for the inclusion of independent members and the development of the plan to a scale that I've certainly not been familiar with since I joined the health board. So it's really great to have been, involved throughout. I just wonder, we are in a difficult position today, aren't we? In a position that none of us would want to be in, with our inability to submit a plan that is a balanced budget. And I know that we have now got a route map that will get us to a better financial position. I'm just wondering whether, in moving forward from today, that we are all sighted on the consequences potentially for the organisation of submitting the plan. The chair referred to further conversations with Welsh Government, but I think we all need to be clear about what might be the response from Welsh Government and what that will mean to the organisation going forward, and whether as we do move forward, whether the executive think there is scope maybe to perhaps condense the latter years of the plan, so maybe get to a position at year 4 maybe than year 5. Difficult at this stage because of course there's lots and lots of additional planning to do, but I just wonder whether that is a feasible ask really to look to bring that in. I'm so grateful to see the very strong emphasis on quality, but also the resisting the temptation to jettison all our preventative work. It would be so easy for us as a board to focus on the burning platform of the here and now. So it's good to see where possible we are recommitting ourselves to that shift left prevention. But I just do wonder, Hayley, whether there is an opportunity here to work with our partners to strengthen that voice of public health. And I'm particularly thinking at the RPB and the Regional Partnership Board, because some of these contents of our plan really need a strong voice around public health at that regional partnership board working. And I wonder whether if we pass this plan today, we can reflect on how we can do that better. Thank you very much.
Thank you. So Chris, and then I will invite response from Hayley and colleagues, but I do know that Ronnie wants to come in as well. So Chris, please.
Yes, thank you, Chair. I just wanted to echo those same points about the hard work that's gone into this on there, and I do feel that as independent members we've been fully included within that process. Again, the focus on quality is really important, and along with patient safety is essential. But I also welcome that there's been a consideration to our staff as well. And it's important because the deliverables of this process is also going to be within those teams as well. So one question is what additional support will be offered to our staff going forward if this plan is then accepted? And then in relation to today's news that inflation has dropped, does that give us any material changes to some of the assumptions that we're making within the plan going forward? Because if inflation is on a downward direction, does that help us, or does it still leave us in a similar position? Thank you.
Thank you. Hayley, back to you and colleagues. I am conscious that we've got some more people wanting to contribute, and I do want to move on to the capital matter in probably 10 to 15 minutes. So thank you, Hayley.
Thank you. So really good comments. So in this order, Pete, can you respond to inflation, Chris's point, and the primary care point first, please? And then I'll come to you, Kate, to offer any reflections on primary care, urgent and emergency care, and then we'll deal with the rest of them, if that's okay.
Okay, yeah, sure. Thank you, Hayley. So if I go with the inflation one first, yeah, thank you, Chris. So with any plan in any year, the plan is made at a point in time based on a number of assumptions. Those things are assessed on an ongoing basis as we move through the year. We have a range of risks and opportunities that we have to manage alongside our plan. So those things will be carefully monitored, and if there are any potential benefits, they will be greatly reflected within our plan. If that's okay, I can add to further it if helpful. I think in terms of Robert's question around the public perception of access to GMS services, I think it's worth reminding us, first of all, that there are circa 85,000 contacts in GMS per month in Powys, and that's against our population of 134,000. So the access and the work within GMS and primary care is significant. That level of contacts is probably higher based on our population than other areas. I think we do have a number of methods by which we gauge the public experience, and that will be from our own surveys, from feedback that individual practices get, and obviously the work that CLICE do, and that Katie's in the meeting, the work that they do to gauge the public perception. I think what we will do is work out how best to engage, best to communicate, and make sure that there's full and proper understanding of the processes, how the system is operating, and to get that feedback from a population to inform and to make sure it's in the best place as possible. So yes, the commitment's there to do that. It will be an iterative process, but we will work to do that. I think that's my two, Hayley. Thank you.
Kate?
Yeah, thank you. So in terms of urgent and emergency care and minor injuries provisions, then, so as you know, currently then we have a blended model of GPs and primary care providing some urgent and quite a lot of urgent and emergency care for us, both a bit of minor injuries and minor illness. We have our MIUs, and then many people do need to go to DGHs in our commission services for an assessment, for diagnostics that we don't have in county and are probably not realistic for us to have in county. I think key is that whilst they need that assessment, then we need to be ensuring that we're returning them back to Powys as rapidly as possible and more quickly than we currently do. So I think that's a key goal for us. So I think we accept that many people will need to cross the borders but then come rapidly back. We do, though, however, we really are ambitious in our wish to do more, and so we're scoping what more our minor injuries could do. We are trying to provide some enhanced training, but what we know is that we have to make change really safely and sustainably, as I mentioned earlier. So I think it's very unlikely that it wouldn't be safe just to suddenly put brand new services in. That wouldn't work. But what we will be doing is looking at change and development on a pathway by pathway basis, whereby we can introduce new models of care, working with our sort of partner organisations, and then auditing and evaluating outcomes as we go, so that we're sure that what we're doing is the right thing for our population. So I see the POWES provision developing organically over time, with close monitoring, supporting and developing our staff, but working very closely with our secondary care neighbours. There is a very important difference between what you can deliver we know we work really better and best in multidisciplinary teams, and we know that what a minor injuries unit might be able to deliver when it's very closely associated with the district general hospital, sorry, I can't get my words out today, is actually different to what an MIU can deliver when it is distant and without that support. So our challenge and our ambition is to really deliver as much as we can safely deliver in that environment, and that's active work in progress.
Thanks, Kate. Just a couple of other points then. So in terms of the organisational consequences of this plan, I think Kirsty's point's a really important one. So, we are currently in enhanced monitoring for finance and planning, and there could be a scenario we will face where escalation will be reviewed as a result of this plan, and we need to be prepared for that eventuality and have that conversation proactively. And just to reassure you, we will continue to be in proactive dialogue with Welsh Government on those points. But I think also your point around 5 years and is our feasibility to condense our ability over a shorter period of time to return to financial balance. I think that is entirely a reasonable ask that Welsh Government will ask us to look at again, and to give assurances of the options around that. And I know as an organisation we'll be keen to get that judgment right, but that is contingent to the additional work we need to do in partnership with our colleagues, with our partners and the public around the options about how we might need to take that forward. But I think that's a reasonable ask, and we need to keep a very close eye on that as a board to try and get back to financial balance as quickly and as safely, with that balance between service, quality and money very much in our minds. And then I think the points around staff, I'll ask Deb just to make a very brief comment about, and also the points around regional partnership work and that burning platform of tension between the here and now pressures and the long term. I'll ask Mererid to comment if that's okay. So can I hand over to Deb? Thanks.
Yeah, sure. Thanks for the question, Chris. It's really important that staff feel involved in the change that affects them. We've heard that in previous NHS surveys. There is a All Wales Organisation change policy which guides our activity. So therefore, working with staff, listening to staff about any changes, any ideas, and obviously with their representatives in the trade union will be really important. We have lots of experience of offering kind of reskilling, alternative roles, job trials. So I think in some respects that will be for a really small probably group of staff, because there are many of our staff that are actually calling out for some of the changes to services because they can see some of those things on the ground every day. So I don't think we're pushing against a closed door on that, and there are mechanisms to manage it. Thanks.
Ms, thanks.
Yeah, diolch. Okay, thank you, Kirsty, and absolutely sort of agree, really, working through partnerships and with partners and equally working with and for our communities that we serve. So a lot of our work currently around prevention is through the Public Service Board, and we do have joined up plans there with partners around key area, but there is an opportunity, and within the plan we've indicated this as well to strengthen our prevention approach through the RPB and particularly through the subgroup of Start Well, Live Well and Age Well to make sure we maximise those opportunities to improve outcomes for our population. So fully support the opportunity that you highlight.
Thank you, Mez. And I know Nina's on the call, and particularly with the new portfolio that Nina's responsible for, and also in the RPB executive group. I don't know, Nina, whether you wanted to comment on that particular point or any of the points. Thanks.
Thank you, Hayley. Yes, I had noted that. I just wanted to make a couple of comments and observations, if I may. I think it's really important as a board, isn't it, to be having a really good discussion on this. So I welcome all the comments and the questions that have been asked. It's a really significant challenging position. You know, we're being asked to, in terms of financially, you know, being asked not meeting statutory requirements in terms of the budget and a significant deficit, etc. So thank you for all the work that's been done to set that position out and the plans that have been put in place to address that. And I think it's been helpful to note the risks around that and what that means as well. I mean, it's such a challenging position in terms of demographics here, in terms of demand, and in terms of the impact of on our workforce as well, and geography and rurality. And of course, these are all challenges that are shared across ourselves with the local authority as well. So I welcome the focus on prevention that is clearly coming through this, and I'm really pleased to see that. I think it's really important, isn't it, that we're keeping people healthy and independent for as long as possible. So that shift left to prevention, are fully supported of that as approach. And within my new role as Director of Social Services and Wellbeing for Powys County Council, that's very much on my priority list as well, is that prevention focus. And I'm just wanted to kind of assure the board that, you know, the local authority will work in and continue to work very closely with the health board on that agenda, and of course as a member of the RPB as well. I think that's a key partnership sphere for us all to be working together on these challenges and these shared challenges. I note the kind of route map to sustainability and the work that needs to be done around that, so look forward to be involved with that, but also as a board member, associate board member as well, being provided assurance as a part of that, and welcome the focus on quality and outcomes. And I just want to kind of finish by saying it's really important that we keep people at the heart of this as well, and that's what I'm very keen to do throughout all the work that I'm doing, and as an associate board member, is we keep people at the heart of all the decisions that we're making. Thank you, Chair, and thank you, Hayley.
Thank you. Okay, so we need to move on soon to consider the report on capital investment. However, just to finish this particular item, it's very unfortunate, but I'm afraid we've not been able to resolve our technical issues in relation to Mick Janas's contribution online. Microphones and so on don't work, but I'm grateful that Mick has used our chat facility, and so if I could just on his behalf express gratitude for the plan and so on. Some of the points that he raises have been covered in questions by Kirsty and others, but there are two things particularly. One is around the implications of not having a balanced budget. So not necessarily to repeat the response to Kirsty, but Mick is asking, are there any other consequences for us as a board, for the organisation or for individuals that we should be aware of? And second question from Mick is about the practical implications of a budget that doesn't balance. In other words, how do we manage it? Do we have to borrow money? Do we have to dip into reserves? Or do we actually need to delay activity that we don't have the money to fund? And so, and finally, also, I will go to Ronnie, who has an observation. Then I will go to Hayley and whoever else for a final response before moving on to capital estates. Thank you, Ronnie.
Thank you, Chair. As I have indicated, this is just an observation. The plan has been the subject of considerable detailed consideration. But Hayley, you are putting in a document which is not financially balanced, as you've referenced. And actually, for me, there's an important principle there. This is our best offer, but it's important that we're open and honest about that, because that, to me, satisfies the public service duty, but also Nolan principles. And I think it's much better to do that than to submit something which is perhaps not necessarily based in practical reality. We also have a suggested route map to achieve improvement, and I think it's important that we show next year's sustained progress on that route map to achieve improvement. And my final point is the submission of this document will need to be accompanied by other documents such as a minimum data set and templates, and I'm just seeking assurance that we are suitably prepared on all of those to meet the timescale. Thank you.
Thank you. So Hayley, back to you for final responses.
Okay, thank you. Ronnie, on your final point, I'll start with the easy ones. All the technical appendices, templates, all of the minimum data set is all ready to go as part of the plan, in line with the key messages and content within the plan that you've seen today. So that's in place. I think a combination of the points from Mick and Ronnie, in a way, is that, you know, clearly we are in constant dialogue with Welsh Government about the current draft of the plan that we are discussing right now in the board, but that's different to receiving the formal submission at the end of this month. So I work in a no surprises environment, so it won't be a surprise to colleagues in Welsh Government that the discussion that we're having today about the seriousness of the financial position that we face and the potential consequences of therefore not meeting those statutory duties. I think that I mentioned earlier about the potential scenario of enhanced monitoring status being reviewed post submission of the plans, and that could result in increased escalation with regard to the financial issues. I'm not afraid of that. I think comes with that a level of scrutiny and further support, which will enable us to be able to provide further assurances to colleagues that we're doing all that we can, and this is the best offer that we can actually submit at this point. Can I also say that this is not a straightforward plan? The level of savings that we've placed in this plan is substantial for us as an organisation already, and I think it's a very fine balance, and a number of people have commented about realism, deliverability. You know, there is a very fine balance between taking the judgment of this to a point where we can take the staff, the organisation with us on this journey, and it feels achievable from a frontline staff member perspective. And I think some of the principles that Nina and others have referenced as keeping us very clearly in the right space as a board on this, with regard to ensuring that we're always putting patients first in the discussions that we have, and we're trying our very best to get the right balance between ambition, realism, and that best offer within this plan. And then the final point Ronnie raised was around the route map to sustainability. We have got to get traction on this and get this clearly set in our minds, and that connects with the work that we're doing also in partnership with other system partners, including the work the local authorities is undertaking on a sustainable powers. With regard to Mick's particular technical point, regards the practical implications of the budget, if it's okay, Carl, I'll ask Pete just to give a quick overview of what that means. Thank you.
Thank you, Pete.
Yeah, just very quickly, Mick. So as a health board, we cannot borrow and we do not hold reserves. So if our plan was recognised as being the best offer, we would look to get strategic cash support to cover the fact that our outgoings will be more than our incoming. So that's basically the mechanism that we use, and we've used that mechanism in this financial year, given that we're in a deficit position.
Thank you. So we go to the recommendations in relation to this agenda item. There are a number of them, so I don't intend to read them all out, but I think it's right that we should just publicly acknowledge that the different components of the recommendation. So very quickly, we are asked to receive this 5-year plan. We are asked to recognise that the plan sets out a deficit position and that we can't meet our financial duty. To recognise that the plan seeks to balance the different statutory duties placed upon us, particularly finance, quality, safety. We also recognise that further work will be done to improve this position as much as possible, and also we are asked to approve the integrated plan for the next 5 years. And in doing all of that, we recognise that there is a series of other component parts of the plan. For example, the joint committees, WISC and ESC, and those components, the clarity around those components will only be seen once various meetings and so on have happened and decisions made. And finally, as a board, we are asked to delegate the final sign-off of the plan to the Chief Executive and to me, recognising that there may be minor amendments that need to be made prior to submission. So given that summary of the recommendations, would you please indicate if you don't support the recommendations or part of the recommendations? Nobody has indicated, so those recommendations are supported unanimously. We go now to Wayne. Welcome, Wayne, our Assistant Director for Estates and Capital, who will introduce the capital programme that we've had in our pack of papers. So, Wayne, thank you.
Yes, thank you, Chair, and good morning. Wayne Tannehill, Associate Director of Capital Estates and Property. The paper presented today seeks approval for the 2-year discretionary capital programme, but also sets out the broader capital ambition for 2024-2025. The discretionary capital allocation from Welsh Government has been reduced for all of the health boards over the last 2 years, but is reinstated at 1.431 million for 2024-2025. The work that is put together, which is expressed through the discretionary programme, is prioritised by the Capital Control Group and covers a number of aspects: service improvements, estates, repairs and backlog maintenance, and IT and equipment. The discretionary capital programme for this year contains a £200,000 contingency, which has been set aside for emerging pressures. Capital funding is becoming a more complex arena. We have been fortunate in the last year to receive direct capital support in the order of 1.5 million for roof repairs at Bronfleece for mental health and outpatients, and we're hoping to receive direct further support from Welsh Government colleagues this coming year for roof repairs and similar activity. I need to mention the end of financial year capital slippage opportunities. By their very nature, these are unplanned, but we have been very fortunate again to secure well over £1 million in January and February of this year, which we've spent predominantly on IT and equipment, which helps supplement the limited amount of money in discretionary capital. We've also been fortunate to have some funding for emergency works, and this has included boiler replacements, car park repairs, and some fire compartmentation work. The Regional Partnership Board, Health and Social Care Integrated and Rebalancing Capital Fund, perhaps more easily referenced as IRCF funding, is again really important and will offer opportunities in the coming year, with £70 million worth of capital held centrally and a pipeline of projects in development, which includes integrated hub work at Spa Road, Llandrindod, and support for mental health services. The decarbonisation agenda remains a high priority, with a bid made via the Refit Cymru programme to Welsh Government SAILEX Invest to Save funding. This is in the order of 4.3 million and will include converting the lighting across the health board 100% to LED, insulation, heating controls and solar PV. If we can secure the funding and complete the work, this will make a very substantial 12.6% reduction to the overall carbon output of the health board, and will include 24.5% reduction in electricity usage, which is guaranteed output as part of this particular programme. Really importantly, All Wales Capital Fund is the central funding that supports business case submissions. The two particular substantial schemes that we will be promoting this coming year will be the North Powys Wellbeing Programme and Llandrindod Phase 2 of the redevelopment there. Welsh Government, by virtue of the limited funding, have introduced a prioritisation process, and submissions of this additional part of the business cases are required by the end of this month, and we're hoping to receive positive news on those submissions for prioritisation sometime early in the next financial year. I will just finish by noting that we've had a shared services partnership internal audit on estates condition. This has been an all Wales audit. Unfortunately, across the health boards, these have been limited assurance outcomes. And the highlighted element that's led to this has been the disparity between the need for capital and the availability of capital. In Powys in particular, we have circa £70 million worth of backlog maintenance, and clearly the investment available through capital funding doesn't meet that particular need. So that's a very quick summary of the paper, Chair, and I'm very happy to receive any questions from colleagues.
Wayne, thank you very much for that succinct but really informative summary. And of course, we do have the report within our pack. So I've got three colleagues that want to come in, and then Wayne or others may want to respond, and then I'm sure that everyone will be grateful for a 10-15 minute break. So Kirsty, and then Ronnie, and then Ian, please. You're on mute, Kirsty.
Thank you, Chair, and thank you to Wayne. Just a comment really to congratulate the estates team. As we've heard, the capital budget is very, very, very tricky for us, but the team are very fleet of foot at taking advantage of end of year slippage and levering additional resources in by having that pipeline of projects ready to go. And I think the way that they've managed that year on year, I think, is commendable and significantly increases our ability to carry out some of the smaller scale, but nonetheless really important pieces of upgrading that we need. And I just also want to say thank you to Wayne for the support that he's given the RPB around its capital programme. A year ago, we were not in this position, so to have moved from a position which was a concern for all of us, to a fully committed budget, and indeed the ability once again to leverage in extra funds to support projects in Powys. I'm just really grateful, and I want to put that on the record for the way in which Wayne has supported that work on the RPB as well, which has got us into a much better position than we were 12 months ago, for which I'm grateful.
Thank you, Kirsty. Ronnie.
Thank you, Wayne. As always, this is a comprehensive report for which I'm grateful. I just have a concern about the radiology information system procurement, and particularly against the background that our existing X-ray equipment will cease functioning in 2026, which isn't actually all that far away. And given that statement of the obvious, these are basic tests to look at bones and joints as well as soft tissues. You know, it's really fundamental, and I have a sense of concern that there's no funding stream apparently in order to meet the digital provision. So I just wondered if you'd like to provide any further comment around that. Thank you.
Thank you. And finally, Ian.
Yeah, thanks very much. Yes, I definitely reiterate my thanks to Wayne and the team for managing a really tricky area, and I wanted also to mention the bit around the risks and the opportunities. Clearly, when you compare the size, I think it's important to note the difference between what we could be spending the capital on with a backlog maintenance of getting on for 70 million and what we have available. That clearly is a challenge. The other thing that I wanted to highlight is and this is true of the digital in particular. It's great that we've had that money end of year. It's great that we've got the plans, as Wayne, you mentioned in the opportunity section, on the shelf, so if money becomes available we can actually move quickly. But I think it is important to recognise, not just for digital but right across the piece, our ability to plan for the future. We've just talked about our IMTP and what we can and can't do. Some of what we can and can't do will be contingent on modernising our facilities to allow us to do that. It really is an impossible ask, isn't it, to be able to plan strategically on the basis of what is a very small amount. It is what it is, but I think it's worth highlighting the impossibility of the ask that we're, what we are trying to balance from a strategic planning and capital perspective. Thank you, Chair.
Yeah, thank you. So if I could then ask colleagues to respond very briefly, because I know that people are probably quite desperate for a break now. So I'll go David, Wayne, and then back quickly to Hayley. So David, please.
Thank you, Chair, and thank you. David Farnsworth, the Interim Executive Director for Operations, and thank you to Ronnie for raising the issue around the radiological information systems and the challenge to our current equipment. Obviously, this is an all-worlds programme in which we are participating, and we aren't the only health board who are clearly affected by this issue. There are a number of health boards, and Wayne has been really helpful to us in this has been separately raised with Welsh Government that this affects a number of organisations, but Wayne's been really helpful in us to help navigate some of the challenges that the capital programmes are facing, which is multiple routes, whether that's the radiological provision of equipment or whether that's the capital equipment provision of equipment approach. But Wayne's helping us nail that down, and we are hopeful that we should have some clarity in the near future as to what the route to future funding for replacement of our equipment will be. But Ronnie is correct that it will be vital that that will be needed so that digitally we can continue to operate our services.
Thank you. I know, Claire, do you want to come in briefly just to add a comment in relation to the RISP?
No, I think David's
okay.
Pretty covered it. Yeah, thanks.
That's fine. Wayne, anything else from you?
Yeah, Thank you, Chair. I'd like to just note my appreciation and thank you to Kirsty and Ian for their comments, and particularly to pick up the question from Ronnie. We have the head of capital for NHS Wales coming to Bronfleece to meet us tomorrow morning. And the risk radiology question is on the agenda. So we will be taking it up directly with the head of capital for NHS Welsh Government tomorrow morning, and hopefully we'll have a clearer pathway forward on that.
Thank you, Wayne. And Hayley.
Very brief comment. The need to continuously secure capital to support our ambition remains and continues to be a really key enabler for us. The position, All Wales position around capital availability is very serious currently, and we have all been asked across NHS organisations to get back to Welsh Government by the end of this month regarding an overarching capital prioritisation process that's taking place. So I think this is one we will need to continue to come back to the board with further updates with regard to the outcome of that work that's being undertaken on an All Wales basis. Thanks.
Thank you, Hayley. And Wayne, thank you so much. And please do receive the thanks and appreciation from board colleagues that has been articulated today. And please convey that to your team and all involved. Much appreciated. And so the recommendation is that we approve the discretionary capital programme 24-25 to 25-26. Does anyone want to indicate that they don't support the recommendation? So that's supported unanimously. Thank you. So we have been going for quite a while now. We do need a break. I know that we're running a bit late, but I think we can probably make up a little bit of time as our meeting progresses during the rest of the day. So I'm still going to say let's take our 15-minute break. So that means that we reconvene at 11:55, please. Have I got my maths right? Yeah, good. 11:55. See you then. Thank you. Wel, croeso nôl i'r cyfarfod hyfryd i gael eich cwmni unwaith yn rhagor. Felly, dyn ni'n mynd i symud ymlaen ar yr agenda, ond dyn ni'n mynd i gymryd eitem 3.4 rwan a dod nôl wedyn i eitemau 3.2 a 3.3. So, welcome back one and all. I'm proposing now that we take item 3.4 on our agenda, and then we will go back and deal with items 3.2 and 3.3 later. Item 3.4 deals with the emergency medical retrieval and transfer service and the ongoing consideration of changes that affect the air ambulance service. We're very aware that that people are very keenly interested in this item, particularly as it affects Powys, and we are equally aware of our accountabilities as a health board, and among those accountabilities, our fundamental accountability to the people and the population we serve, and to make sure that our decisions are in their best interests. And so I'm going to ask now Hayley, our Chief Executive, to introduce this item and to bring others in as needed and as appropriate. Thank you, Hayley.
Thank you. Yes, and the papers that we circulated for today's board meeting obviously was before the meeting that took place yesterday of the Emergency Ambulance Services Committee, which I attend on behalf of the Health Board. So part of this update is to bring the board up to speed with the discussion and decisions that were taken yesterday in the EASC meeting. So just as a reminder, if I could move on a slide, if that's okay. So just wanted to remind us of the decisions for the board that were set out originally in the papers that you've all read before today. And that was clearly asking us to consider and agree 4 recommendations that have been put forward by the Chief Ambulance Service Commissioner with regard to the preferred option with the EMIT service model. So that's what you've read, and that was the information and the suite of appendices and detailed reports that we received that we considered in the EASC meeting yesterday. So I'll give you an update on that now. So next slide, please, if that's okay. Governance context is important. So just as a bit of a reminder, the committee that was held yesterday is a joint committee of all the 7 health boards in Wales and is hosted by Cwmtaf University Health Board. And the committee is responsible for planning and securing sufficient ambulance services for the population. And I, alongside the other 6 chief executives of organisations in Wales, we all sit as members of the committee and we collaboratively commission emergency and non-emergency ambulance services. And that obviously includes the review of the emergency medical retrieval and transfer service that we work closely in partnership with the Wales Air Ambulance charity to provide. For awareness, there's a paper later on the agenda. There will be a new joint committee established from the beginning of next month on the 1st of April, and that will supersede the both the Emergency Ambulance Services Committee, but also the Welsh Health Specialised Service Committee as well. So really been very involved in the establishment of the new committee arrangements regarding that. So the Chief Ambulance Services Commissioner presented yesterday his recommendations to the meeting, and the plan was, as is today, that we discuss that as a health board, and other health boards have got meetings next week to consider his recommendations. And currently the plan is that there's an additional meeting of the EASC committee planned for the 28th of March to receive the views from the 7 health boards and to set out the way forward. So I thought it was helpful just to remind us of that. Okay, on the next slide then, please. Couple of key points to cover that we clearly discussed yesterday in the committee. The first thing is, you know, the whole purpose of this review was to address the work that was undertaken that identified that there is unmet need across Wales, 70% of which arises after 8 p.m. in the evening. And just to give you a sense of scale, that's 2 to 3 people per day from all health boards across Wales that are currently not able to receive the service. And the view was that we needed to look at a review to see, is there any way in which we can reduce, through realignment of our resources, address the unmet need. And clearly this is a life-saving service and has excellent clinical outcomes. So we really want to bear that in mind as we discuss these points. Clearly in Powys, the strength of feeling of the public regarding how much they value this service and the Wales Air Ambulance charity has been second to none. So it's clearly attracted a lot of attention. We've had a petition of 37,844 names handed in with regard to this issue. And when you look at the detailed appendices, you will have seen through the analysis that 66% of the response rate for the whole of an all Wales service has come from Powys during the phase 3 engagement. And clearly there are a number of issues that have been highlighted and concerns from the public and the people who've responded, not just in terms of the plans for the EMIT service, but also regarding people's experience of and confidence in the urgent and emergency healthcare system as a whole. And so there's clearly a public confidence issue for us to be aware of as a board with regard to this matter, and in particular the need to continue our engagement with our population to raise awareness and understanding of the current model and how it operates. So the phase 3 engagement, I would say, really strong response from Powys, but probably overwhelmingly negative sentiment towards the options presented. So we do need to consider as a board those issues and themes that have come out through the consultation and engagement process. The third aspect to this, which is really important, is Wales Air Ambulance charity. Such a great charity, really valued and working in partnership with us to deliver these really important services. For those of you who may not be aware, but Wales Air Ambulance charity is the majority funder of this vital critical care service. And I know that we need to thank today the patience of the team at Wales Air Ambulance charity, the staff, the volunteers, and to everyone else that's been involved in supporting fundraising for this organisation to go through this process. And clearly, you know, the organisation, I've been made aware only yesterday that clearly some of the staff and volunteers are finding this very difficult and have experienced really negative and quite abusive experiences as a result of the discussions that are taking place at the moment about the future service model. So there is an urgent need for us to conclude this process and to provide stability and direction for the staff of the charity. But we need to do that, making sure that we're meeting the requirements as a health board from a process perspective as well. But I thought it was very important that you're aware of the pressures that Wales Air Ambulance charity are currently experiencing. And in particular, I would say that we need to work alongside the Wales Air Ambulance charity as a health board in relation to continuing to maintain public confidence and to help them to continue to maintain charitable income streams to support the delivery of this service. Next slide, please. As part of the recommendations contained within the papers and in the review undertaken by the Chief Ambulance Service Commissioner, it was really clear that there were some principles underpinning this work. The first one is, if people receive the service now, they should receive the service in future. And I think that's a really important principle which we signed up to from the start. And clearly, in terms of recommendation 4, which is the description of the bespoke road-based enhanced or critical care services in rural and remote areas, we had indicated clearly to the Chief Ambulance Services Commissioner that we would need to understand the scope and the detail of that service very carefully in looking at the overall suite of recommendations that we were being asked to consider as a health board. And at that point, I was quite clear on that point yesterday as your representative in the EASC committee as a member there. So critically, in yesterday's meeting, there was a view that was supported by the committee that we need to look at all 4 recommendations collectively rather than individually, and that further assurance and detail is needed regarding recommendation 4, because clearly there is some downside impacts that have been identified in the assessment for not just Powys but for other rural parts of Mid Wales and North Wales. And then the final point, and I will give you a bit of a warning, Katie, Katie Blackburn, our Regional Director for Llais, is here today. It is very clear to me that the representations and the way in which this piece of work, we've worked alongside Llais and other stakeholders, is really important. But clearly, post the completion of the full phase 3 engagement closing date, Llais received the final report and have indicated in writing to EASC, which we considered yesterday, some formal representations of assurances that they're seeking as an organisation with regard to the decision making and issues contained within their representation. We did have some oral discussion and reporting with regard to this in the meeting yesterday, but clearly we need to move that into a written response that the board can look at in partnership, so that we can take fully the assurances that we need that any concerns that Llais has had has been fully addressed and dealt with. So on that point, before I sort of summarise, I would wonder if Katie would like to come in, Katie Blackburn, to perhaps just give a view of the correspondence that we received last week.
Thank you, Hayley. Yes, I'm very happy to update members of the board. I think firstly, just to make sure members are aware that the letter that I sent to Hayley was also sent by to every chief executive of every health board across Wales by their respective regional directors for consideration in their discussions at their board meetings. I think it's also quite important to note that we didn't actually access the papers until last Wednesday when they went live on the internet. So I guess my apologies that you didn't receive my letter until Friday, but we didn't have any insight or sort of foresight as to the publication of those papers. So I do appreciate that you haven't had a very long time, you haven't had much time at all to consider the letter that was sent on behalf of Llais. I think it's also important just to note that, as we're all aware through the legislation, that there is a statutory guidance on representations made by Llais, and I won't go into the specifics of those, but a critical role of Llais is obviously to make sure that the voices of citizens are both listened to and heard during any time of a significant, well, any time of service change. And obviously since we were first made aware of this proposal back in August, I think it was 2022, through social media. We've been keeping a very close eye on the views and the thoughts and the comments and the observations made by, in my case, the communities of Powys. So with regard to the process on the whole, I think it's fair to say we've had the opportunity to comment upon the documents and the engagement material that have been provided, and I think the general feel is that the engagement process was very comprehensive. I think the concerns that are listed in those letters are that there's still a lot of concern out there within the community, and it is our duty to make sure that those voices are heard and that those concerns are raised. So the letter that I've sent, which is in your board papers, just highlights the key issues and concerns that we've heard, particularly in relation to phase 3, but I think it's important to note that actually the concerns and issues that have been raised have been consistent across all phases, and secondly, that we have made a number of observations. I won't read them out there, but just noting perhaps the need for additional detail for the 4 recommendations that have been provided. Chair, I'm conscious of time, so I'll just leave it at that, but I'm happy to be brought back in if that would help.
Thank you, Katie. So back to you, Hayley, for any final summary, and then we'll ask for contributions.
Thank you. So if I could go on to the next slide then. So clearly, in light of the decision not being taken yesterday in the East Committee to put forward these recommendations for decision to the board today, we've revised the recommendations for us to consider in this meeting. So the board is asked to note the progress made on the review and the recommendations from the Chief Ambulance Service Commissioner, to note the key considerations for Powys Teaching Health Board in the report I'm just giving, to note that further work is underway on the development of a more detailed proposal for a bespoke road-based enhanced and/or critical care services in rural and remote areas, and that information is essential to support our decision-making process. To note that further work is underway to therefore respond to the issues raised within the letter that Katie's kindly just taken us through, and other representations that have been forwarded to the East Committee, and then endorse that further work be undertaken by the Wales Air Ambulance Charity to scope an appropriately located operational base in line with findings to support future decision making. And just to clarify that point, we're not actually asking Wales Air Ambulance to secure, but in order for us to take a decision as a health board on the suitability of the best preferred option for this service, understanding the location of the proposed single site is an important factor for us to be aware of, so we need further detail on that regard. And then finally, note that an updated timetable for final decision making will be shared with the board. This is a live issue currently. EASC met yesterday, and clearly health boards are planning to have those discussions over the next week. So as this develops, we will keep you appraised of any changes to the timetable for decision making.
Thank you, Hayley. Clearly, the situation is fast moving, and changes are happening. Not so much as we speak, but changes have happened and will happen at a fast pace. So, but I will ask now for any contributions, comments, questions from board colleagues, and open this up for discussion. So Ronnie, please.
Thank you, Chair. I think perhaps this is an observation. rather than a question. But perhaps I could begin by just saying that I would wish to acknowledge the considerable work that the charity does in fundraising and in the provision of equipment, and I think it's important that we all acknowledge that. I looked with interest at the report from Picker, which is referenced in the papers, and for me, there was one paragraph which stuck out particularly. When asked to prioritise a selection of priority statements, the top three where everyone in Wales should have equal access to the service should be structured to treat as many people as possible, and before any change happens, there must be a plan for the service to support patients to the same standard as it does today. And for me, those seem to be three really important statements which reflect public interest and concern. And clearly, we're principally concerned about how those apply in relation to Powys, but I think we need to be deeply conscious of those three driving principles in any decisions that are made. Thank you.
Thank you, Ronnie. And Nina, please.
Thank you, Chair. I think it's important, just I want to start by noting that, the air ambulance is a much loved, highly valued service across Powys and Mid Wales. And I think that's just reflected by, the 66% of respondents coming from the Powys area as well. And I think it's really important and essential that any proposed changes to the service must be carefully scrutinised to ensure that our rural communities across Powys are not disadvantaged. I note the importance of addressing the unmet need and in resolving this process. And I, appreciate there's been a long period of uncertainty for the charity, the staff, and the volunteers, and all those involved, etc. For me, it's been made quite clear that we need to look at these recommendations collectively. And at the moment, I don't think we're able to assess those recommendations fully. There's insufficient detail around a number of the recommendations. And I think it's essential that we have further information and assurance around the impact, benefits of costs of recommendation 4, for example, to enable that we as a board can make an informed decision. And I'd also like to just pick up on, the importance of that we have clarification and assurance around the comments that Lice have raised, and that the engagement responses have been fully considered as well. So that my comments. Thank you, Chair.
Thank you. Chris.
Thank you. I just want to echo those sentiments that Hayley said about the preparation of work that still needs to go on in relation to the charity, because it's important that we have all of the factual information in regarding to where a potential base could be going forward if that is the decision that was made on the. I've been concerned and hearing obviously the commentary regarding the charity and its impacts on the going forward, and it's something that I've raised on other occasions to it, because if that funding stream stops or reduces, does that then put in the future model into any form of concern going forward? And it'd be interesting to see if there's been any consideration of that. Also, I note the petition has got quite a large number of over 37,000 signatories. Based on the other responses that we'd had from Powys, 66% had come from Powys residents. Do we know where those signatories have come from in that other petition, and are they from a majority coming from Powys residents as well on there? And then the other question that I didn't realise is that we commission this service in the sense of as a health board. So if there was a legal challenge, that legal challenge would come to us, and are there any cost liabilities to the board for that legal challenge if it came around? I'll stop there.
Thank you. Thank you, Chris. So I know that Steve wants to come in, so I'll go to Steve first and then perhaps back to Hayley. And in the absence of any other contributions, we'll consider the recommendations. So thank you, Steve.
Thank you, Carl. And I echo all the comments around the great work there that the Welsh Air Ambulance charity undertakes. But really, you know, it comes back to the reason for the review. Because as we know, 2 to 3 patients per day are not getting this life and limb saving service, and that includes parish residents and residents across Wales. So we do need to quickly come to a conclusion on the detail of recommendation for what that means to safeguard those rural areas, and also alongside that, what can be done to improve the WAST road performance as well for parish residents. So I'm keen that that is concluded as soon as possible because of the very reason for this review. Thank you.
Thank you. So back to you, Hayley.
Thank you. So in order, if that's okay, starting with Ronnie's comments about the 3 really important principles that he highlighted from the PICA report. I think that is the reason why, as a health board, we have requested that additional detail on the scope of the model so that we're able to really test and meet those 3 principles in relation to the preferred option that's being forward. And I think a constant reference back to that is really helpful to us in our decision-making process. So I really agree with Ronnie raising that point. And I think in particular, the other issue which Nina raised, which is around the recommendation for our ability to test that from both a benefit, accessibility and cost perspective in terms of quality and outcomes is important as well. And tying both comments together, we need to make sure that that service, if then approved, is fully in place and tested before there's any change to the base locations. It's a bit of a fire break decision we would need around that, because that is the suggestion that that part of recommendation for that outreach model would mitigate the downside impact for our population. And we need to see the detail of that and be able to give the public confidence that that is definitely the case from the detailed assessment. I think the points around the conscientious consideration of the Llais representation is important, and I know that the team at EASC are working very hard to respond to those so that we have that available as a board as quickly as possible. And I think that the point that you raised around the first of all the legal challenge and the cost of liabilities, it is correct. If there was a legal challenge, a judicial review challenge to this process, the health boards hold that risk and would be holding both the liability of responding to that as the statutory health board accountable to the Powys population, and there would be costs associated with that, clearly, which we would have to build in. With regard to the particular point that was raised around the response rate on the survey, the petition, could I ask Adrian to come in on that, because we only received it a couple of days ago and I couldn't, I think the majority are Powys residents, but I need to check with Adrian. Is that okay?
Thanks very much, Hayley. And yes, just as a reassurance, the existence of the petition was already known and it is referenced within the engagement report. So you'll see the reference to that on page 30 of Appendix 1, for instance. So the issue was this week that we formally received the printed version of that in advance of the EASC meeting yesterday, so I collected that from the local campaign group. This specific petition is predominantly a paper petition. The headline message was hands off our ambulance base in Welshpool. Because these signatures were predominantly collected through face-to-face activities, particularly within the Powys area, a majority of these, based on just my initial review, are local. There will have been other people from neighbouring regions and visitors also signing this, but as a board, we need to take into account that this is quite a significant indication of the views of our local residents.
Thank you, Adrian. And then just a couple of final points, really. The first one is that in terms of the impact on the charity, and Chris, your point, I think we should be very concerned about the impact on the charity. I know that I mentioned earlier about some difficult behaviours that staff and volunteers are currently experiencing, and I understand that they are experiencing significant and material threats to their income streams as a result of the, I guess, the strength of feeling and the contentious nature of the proposals that we're currently discussing. So I think that one is one of the key concerns that I have, which is the impact of this, both in terms of taking the right decision to meet the, going back to Steve's point, we can't ignore the fact that as this process is continuing, we are still in a position of unmet need across Wales, but also the impact of giving certainty to the charity as quickly as we can, but the process has got to be able to withstand substantial scrutiny. And then the final point is public confidence. As a health board, I know that in terms of our risk appetite and how we work, our reputation and our public confidence is a really important factor. And I think this piece of work is something we need to reflect in terms of the risk appetite that we have in terms of our population strength of feeling and the risk that we have reputationally and in terms of public confidence in making sure that we're taking the right decision for the population of Wales, but also in line with the principles that Ronnie set at the beginning, which is to make sure that everyone gets the same service. Thanks, Carl.
Hayley, thank you so much. So we have on our screens the revised recommendations in light of the recent conversations and meetings. I won't go through them because they are on the screen. They're there for us all to read and to consider. But I will ask, does any board member want to indicate that they don't support and approve either the recommendations en bloc or any one of the recommendations? No one has indicated, so we therefore conclude that those recommendations are supported unanimously. Thank you very much. As we started saying, a crucially important matter, a very sensitive matter, and one that we certainly want to get right for the population that we serve, and so in partnership with others, of course. So thank you to all involved. So we go back now to items 3.2 and 3.3 on our agenda, and just to remind everyone that what I said earlier in the meeting, that these papers alongside others have been subject to detailed attention and scrutiny by various committees, and so we don't want to replicate the work of that committee in our board discussions today, but I will go in this case to Ian as chair of Workforce and Culture to receive assurance from the perspective of that committee. So firstly, to item 3.2, the strategic equality plan, and it's going to be introduced by Deb, our executive director of Workforce and OD. Thank you, Deb.
Thanks, Chair. The strategic equality plan for the Health Board covers 24 to 28 and sets out how we'll create an environment where we'll advance all of our efforts on equality, have zero tolerance to discrimination, promote diversity and foster healthy working relationships. As you say, the report has been reviewed previously by at a board development session and has been seen at Workforce and Culture Committee, where it was recommended for approval to board today, and any comments gained through that kind of journey of drafting have been incorporated into the objectives on page 3 and 4. The report also covers how and who we consulted and what we heard. If approved today, the plan will then be updated in terms of the data, because we're not at year end yet, then translated and published on both our internet and intranet. Happy to pause there and take any questions. Thank you.
Thank you very much, Deb. So Ian, from the perspective of your committee and its engagement with and scrutiny of this document, any comments?
I've nothing to add to what I was said earlier, apart from to say that it has been considered in detail and that the Workforce and Culture Committee recommends acceptance, having done that detailed work.
Thank you, Ian. Are there any that want to contribute in relation to this agenda item, to ask questions or offer observations? No, so the recommendation is that we approve the Strategic Equality Plan 24 to 28. Please indicate if you don't support that recommendation. So that's supported unanimously, and in similar vein, we move on to the Welsh Language Strategy in Healthcare, and back to Deb.
Okay, thank you. So really proud to present the Welsh Language Strategy in Healthcare, which covers 2024 to 2029. It's a really important document setting out our direction of travel and how we improve the competence and confidence of the use of Welsh language, both in our workforce conversations and in our service delivery. Again, it's been a subject of a board development session. It's been to Workforce and Culture Committee, where they approved where they supported approval by the board. In a similar vein to the Strategic Equality Plan, we will update this with data at the end of the year, translate it and publish it. Happy to stop there and take any questions. Thank you.
Thank you, Deborah. Back to you, Ian.
Yeah. Only one thing to add, really, and that's also this report has gone through the Welsh Service Leads group as well. But again, as Deborah said, the Workforce and Culture Committee recommends acceptance to the board.
Diolch o galon. Are there any questions or contributions in relation to the Welsh Language Strategy? Na, felly yr argymelliad ydy bod ni yn cefnogi strategaeth yr iaith Gymraeg o fewn gofal iechyd 24 i 29. It is recommended that we approve this strategy. Please indicate if you don't approve. And that's approved unanimously. Thank you, and Deb, thank you to all your colleagues that have put the work in. As you say, we looked at this in detail at board development sessions, both those reports, and certainly the input from various colleagues was impressive and appreciated. So thank you. We move on now to item 3.5, and we are asked today to approve a new corporate parenting charter, and Claire Roche, our Executive Director of Nursing and Midwifery, is going to introduce this item. Thank you, Claire.
Diolch, Chair, thank you. So delighted to be able to present this to board today. Supporting care experienced children and young people throughout their childhood and as they leave care should be the responsibility of all public sector bodies. And the Corporate Parenting Charter is a set of principles and promises that have been developed in collaboration with care experienced young people. This is about being person-centred. We talked about being person-centred just a few hours ago when we presented our IMTP, because the Corporate Parenting Charter describes a set of principles and promises The paper that you have before you this morning explains the local practical arrangements for how we as a health board will work with our partners in the local authority to deploy our collective responsibilities as corporate parents. And as such, Chair, I am seeking today board approval for us as a health board to sign up to this very important charter. Thank you.
Thank you, Claire. Kirsty, please.
Thank you, Chair, and thank you, Claire. I'm very pleased to see this on our agenda today, and the recommendation from the executive team that we become signatories to this charter. Looked after children are some of our most vulnerable citizens, and we know that those children and young people often experience poorer outcomes in all areas of their life as a result of their care experience. That includes educational opportunities, economic prospects, health. Those children are usually suffer from poorer health and are in more danger of suffering poor mental health, as well as issues around addiction. But I also think that we need to understand our role as a very important civic institution within the County of Powys, and working with our partners. I think there is more to do, not just to provide services in the sense of that relationship between a patient and a service, but actually we can look to support opportunities, for instance, in career development and education, apprenticeships, by working proactively with our partners to expose those young people to the opportunities that the Health Board has, and look to support them in more than just that therapeutic or patient healthcare related interactions. But very supportive and very pleased to see this here today. Thank you.
Thank you, Kirsty. And Hayley.
Yeah, Kirsty's covered far more eloquently than I could, the importance of this. I really welcome this charter, and I think in particular just on the employment opportunities part of this. I think our Workforce Futures programme that Deb leads in partnership with the local authority, Kirsty mentioned apprenticeships, but it's really important for me to see that I believe there are implications for us as a health board in implementing this charter, because it's how do we make a difference in our decision making to support actively taking positive action to address our requirements in this charter, and I think particularly in the Grow Our Own Workforce Future space there are particular opportunities that we should exploit and explore further. So this is a fantastic charter, and I'm delighted that as a health board we'll be able to support it. Thanks.
Thank you, Hayley. I can't see anyone else wanting to contribute. So just before we come to the recommendation, I suppose, Claire, a bit like Hayley was intimating, it's there seems to be enthusiastic support for signing the charter. I suppose that the question is the so what, isn't it? How will we as a board remain cited on the difference that signing the charter has made? What kind of information will there be, and where will that go?
So I think in answer to that, Chair, I think that information needs to be presented across all of the organisation. Actually, I think it would do the Parenting Charter a disservice if we were only monitoring that through one particular part of the organisation. So I think embedding it across our organisation. So, for example, I would see that in the workforce and our workforce committee, that all of the work that we are doing in terms of our workforce futures and our Grow Our Own programme, there is an emphasis there on how that particular piece of work and strategy is supporting any looked after child that we have within Powys. And equally then from a quality perspective, we would see it reported in that way. So I think we do need to think about this so that it's not one dimensional. Clearly this work has been brought to the fore by our safeguarding team, because we have our looked after children nurses that obviously are key to the service we deliver to our looked after children. But I would want to see it being presented across the health board in a multiple forum way, so that actually it isn't just one dimensional and seen as a safeguarding matter. So I think that's a bit of a challenge to us all.
Okay. Thank you, Claire. So perhaps perhaps we could agree. Helen, perhaps you might help us across our committee work plans and so on, just to consider how best to make sure that, as Claire says, across the organisation, we are cited on what the implications of signing this actually are. Yeah. Okay, thank you. So the recommendation is that we note the content of the Charter and that we approve its signing. Please say so, indicate if you're not content to support that recommendation. So we are content and we are happy to sign it and make sure that it has the impact that it's intended to have. Thank you very much. Item 3.6 on our agenda, the Welsh Joint Commissioning Committee and the various changes. We're back with you, Hayley. Thank you.
Yeah, thank you. So you'll recall that we reported previously about the establishment of a single joint committee, which is combining the functions of the Welsh Health Specialised Services Committee, the Emergency and Ambulance Services Committee, the National Collaborative Commissioning Unit and Sexual Assault Referral Centre work into one single arrangement, which means that it's simplified and streamlined and also a central point of NHS commissioning expertise in NHS Wales. So the report sets out generally where we are in terms of the move, and we're on track to establish from the 1st of April. But in particular, it was really about making sure that this work is the substantial amount of work being undertaken, and we have, outside of the board papers being shared today, we've had the standing orders and the standing financial instructions, the scheme of delegation and reservation of powers through earlier this week from the Minister as a ministerial direction. So we're seeking approval of the board today to agree through the use of urgent chairs action in line with our own health board standing orders to formally adopt the ministerial directions that we've received with regard to those matters. Happy to take any questions, and Helen may want to comment also just on the specific governance point, Carl, about why we feel that's an appropriate way to handle the situation.
Thank you. Helen?
Thanks, Carl. Thanks, Hayley. Yeah, just to clarify, fully support the recommendation to respond to the ministerial direction through Chair's action. The predominant reason for that is that they hadn't been released in sufficient time for them to be considered along with our board papers today. The standing orders and the standing financial instructions have subsequently been received literally in the last 24 to 36 hours. So if the board are content, we'll turn that around into a Chair's action request either later on today or tomorrow. So I think in that context, Carl, it's appropriate to take that action. Thank you.
Yeah, thank you. And just before I go to Ronnie, you know, I noted in the Minister's letter to me that we are, I think her words were, we are required to adopt these. So in a sense, there's not a lot of choice here, is there? So so Helen, you know, in a sense, it is a requirement placed upon us, and so yeah, I suppose what I'm trying to get a sense of is it's a decision, but it's a decision for us, but at the same time it's a requirement, and it just yeah.
You're absolutely right, Carl. It's a requirement that the Minister has asked the board to take, but the board still has to formally make that decision. And of course, should the board not be content to, we could absolutely respond to the Minister and explain why. But you're right insofar as it being a ministerial direction.
Ronnie, please.
Thank you, Chair. No issue with the recommend. My question really relates to the appointment of the chair and lay members. And someone has said that this organisation needs to be in place by the 1st of April. I'm just asking for clarification as to whether the necessary appointment procedures have been taking place in good time, and whether or not everyone will be in place on the 1st of April insofar as we can establish. Thank you.
It may, Hayley wants to come in. I was involved in the appointment panel actually, Ronnie, so I do know that the panels have met and that the work has been done and the recommendations been made. I don't know, but Hayley, do you have an update?
I'm afraid I don't, Carl. Ronnie, I think it's imminent, the potential announcement around those roles. It hasn't been highlighted any risk. I was in the implementation meeting earlier this week, overseeing the creation of the joint of the new joint committee, and it wasn't highlighted as a concern. And just to reassure you, we can double check that position around timescale, Ronnie, to give you assurance on that. But also there's rapid work has been undertaken on key personnel as well to work within the organisation. So perhaps we could send a note out when we're informed about the conclusion of the appointment process. Is that okay?
Thank you, that's reassuring. I'm simply anxious to avoid a situation where an organisation is moribund at inception. Thank you.
Thank you, Ronnie. Okay, well, so we are asked today to note the establishment of the new Joint Commissioning Committee, to note that it would actually supersede current arrangements through WISC and through EASC, and to note the new committee's governance framework as a key component of our own governance framework, and importantly, to agree Chair's action in relation to adopting the new standing orders and the new scheme of delegation and the standing financial instructions. And so, as per our practice, please indicate if you're unhappy with those recommendations or any component of those recommendations. So everyone supports the recommendations. Thank you very much indeed. Item 3.7, we're back with Steve and the Integrated Quality Performance Framework. Thank you, Steve.
Yeah, thank you, Carl, and I'll be presenting this paper with Claire Roach also on the call. So colleagues will be aware that in September 22 we updated our integrated performance framework for the Health Board, and what this paper is doing is bringing forward an important amendment to that framework by the enhanced inclusion of quality in that framework document, and that's in light of the Health and Social Care Quality Act that came into force on April 1st of April 23. So the framework itself is looking to fully embed quality in everything that we do, and Claire will explain some of the overarching principles and mechanisms by which we will do that in the organisation. And really the revised integrated performance framework, which is the new name we're suggesting for this document, it'll act as the overall mechanism for performance management in the Health Board in its broadest sense. It describes the meeting and reporting structure that underpins the application and oversight of the framework, and it sets out the principles for performance management within the Health Board, including that sort of culture of support and continuous engagement, improvement. So I will pause there and invite Claire in. Thank you, Claire.
Yeah, diolch. Thanks, Steve. So really delighted to be able to present this with Steve today. It feels like a really important maturity and modification of what was already a significant piece of work done by Steve and his team in relation to the integrated performance framework. So the new or the revised integrated quality performance framework really strengthens our focus on our duty of quality. It supports and enables us to understand how we can deploy a quality management system within our performance and quality framework. It includes the addition, importantly, of a quality and escalation process. It describes both the meeting and the reporting structure that will enable us as a health board to ensure not only effective performance management, but also really effective quality governance. And it also provides clarity on the roles and the responsibilities of individuals across the organisation. I would like to commend our respective teams for the significant amount of work that they have put into this document. Often it belies the amount of work that goes on behind the scenes, but really seeking today to have board approval for the revised integrated quality and performance framework. Chair, thank you.
Thank you, Claire. Anything else from you, Steve, or shall we open it up for comment?
No, thank you, Chair. Thank you.
Thank you for that. Quality and the new legislation and requirements and so on have often been part of our discussions and on our meeting and development session agendas, and as we noted earlier, is a fundamental principle on which we plan and on which we operate. So incorporating this into the performance framework seems both important and very, very welcome. But I'm just pausing to see whether or not any board colleagues would like to come and ask a question or offer a comment or an observation in relation to this item. Hayley, please.
Yeah, thank you.
And then Chris.
Thank you. Claire, Steve and the whole team, thank you for updating this, because it is a massive step forward for us. Two comments I wanted to raise is that it's really important that this is really distributed, supported by the board, and its profile understood across the whole organisation. This is part of also us pushing forward a learning culture, a supportive culture. We know we'll have performance hotspots and issues and quality matters to deal with. And I think having that clarity of approach across the whole organisation so that teams understand how it all fits together is a really important part. So how we implement this is the point I wanted to raise, and how we socialise this across the organisation will be an important factor in helping us to drive forward with the intent of the framework, which is really about supporting people to do the best that we can for the patients. So, but doing it in a supportive environment. That was the point I wanted to make. Thanks.
Okay, Chris.
Thank you, Chair. Welcome this paper. I think it's a real help, and particularly as the focus towards quality and the duty of candour come in, and those legislation changes in, it's important that we have a system that is responsive to it. I think I did raise some previous questions about whether there was a link in to professional standards, the NMC code, and obviously medical team codes and other registered bodies as well. And I see that that is included within there. Hayley picked up on some of the points that I was going to make around the implementation, but the one thing, just picking up on the support, What I didn't necessarily see on the with the papers is the link to staff side, and I just wondered whether as a part of that escalation process, would there be an engagement within the staff side representatives, because it's about how we support staff overall, and particularly if an individual member of staff has a issue with professional standards, they may need that additional support. I've seen that in the past, and I just want to get that clarification that that is there. Thank you, Chair.
Hayley, would you like to respond to that?
Actually, could I ask Claire to respond to that?
Yeah, by all means. Yeah, please do, Claire.
I'm very happy to respond to that, Chris, and I think it's a really important question. I think, you know, what is important to realise is that this framework links with lots of other things across the health board. So, you know, clearly we've got, you know, registration, revalidation, professional standards, documents that support us in that. But we've also got documents such as the Speaking Up Safely documentation. So for me, this is, you know, one part of the jigsaw puzzle of various different frameworks that we have in the organisation to support psychological safety. And this should not be something that people feel is in any way a tool to be afraid of, or that it is about perpetuating blame. As Hayley said, this is about supporting a learning culture and enabling our respective teams across the organisation to own that own learning culture within their respective teams, and that enhances accountability. And I think that word accountability sometimes can be presented in a negative way. Actually, accountability is to be embraced because it is about owning what you do locally. And of course, in relation to any matter that we would have that we would need to address with anybody, would absolutely work with our trade union partners across the board. And actually, I think in terms of the implementation of this, we will be seeking to work in partnership with our trade union partners and using our local partnership forum as a vehicle to be able to support the implementation so that it is seen as a really positive and proactive step to our learning.
Thank you, Claire. I can't see that anyone else wants to contribute, so thank you for the paper, for its presentation, for the discussion. We acknowledged how what an important enhancement of the framework this is, and recommended to us now is that we approve the proposed revisions to the integrated quality and performance framework. Does anyone not support that recommendation? So that again is supported unanimously. Thank you very much indeed. We turn to the minutes of our previous meeting held on the 31st of January, initially for approval. So are there any corrections or amendments that anyone would like to suggest? No, so we accept those minutes as a correct record, and we turn our attention to the action log. There is only one action which is completed, and so unless anyone indicates to the contrary, I assume that that doesn't need any further discussion by us today. Are there any other matters arising from the minutes that aren't dealt with on the action log? No, so thank you for that. So that brings us quite neatly to food and to our lunch break. So it's now 1 o'clock. I presume that we take our full half an hour's lunch break and that we reconvene at 1:30, 13:30. And I shall see you then. Enjoy your lunch. Thank you.
Hi, Hayley.
I think we're still on live now, Robert.
Are we? Okay, I'll just wait for everyone to join then.
Yeah, I think so, because it says it's still counting down. I'm not sure if it's been stopped.
I'll recede into the background then.
I might be wrong, Robert.
Better not take the chance, eh?
Hello all.
Hiya, Carl. I'm not sure if it's still live because it's still counting. I'm not sure if it's been paused. Thought I'd just share that.
I think probably, yes, I think probably we are still broadcasting, Hayley. Yeah.
Right.
Okay, just to say that Helen is involved in a discussion elsewhere, so she may be a little late joining joining us. But Liz, perhaps when you think we're good to go, you could just let me know, please. Wel, croeso nôl, a gobeithio bod chi gyd wedi mwynhau egwyl cinio dda, a bod chi'n barod i ail gydio yn ein hagenda heddiw. It's good to see you back. We've had a good lunch break, And we move now to section 4 on our agenda, adran 4 ar ein agenda, sef eitemau ar gyfer sicrwydd. So we move now from items that required our specific approval to items that are here for our assurance. And that's quite an important and technical word, isn't it? So as a board, they're not just here for information, but we need to assure ourselves that the information provided in these reports and in these papers do provide us with the assurance that that we think is sufficient and adequate. And so without any further ado, we go to item 4.1, to the financial report and to our Director of Finance, Pete. Thank you, Pete.
Thank you, Carl. So I assume that everyone's had a chance to read the paper. The paper is in the usual format. This is given a report on our financial position and performance to month 11 of this financial year. As I go through, I'll reference the actual page numbers as they are within the finance report. So we just pull to first of all to page 1, giving an overview of our position at month 11. In terms of revenue, we have an overspend year to date of 11.693 million. And we continue to hold our forecast of a 12 million deficit position at year end, which is in line with our targeted control total. In relation to capital, our capital resource limit has increased significantly over the last month or two to 6.3 million. That's on the back of us being able to secure additional funding that was made available against slippage. Our spend to date is 2.665 million. But plans are in place to discharge and spend the capital in full and remain within our capital resource limit. As I just run through the report, the usual analysis is included in terms of our key cost pressure areas. They continue to be our spend in relation to agency, our spend on commission services in the main triggered by an increase in emergency activity, and our spend in relation to prescribing, and our spend in relation to continuing healthcare. The full analysis is included within the papers. I won't go through it in detail, but we can pick up on any questions. I think the key message is, and this links back to our conversation earlier regarding our plan, these are our key cost pressure areas. They're the areas that have contributed to our increased costs in relation to inflation and growth. And these are the areas which we need to pay particular focus on and to manage and minimise spend as far as possible and our overall delivery of our financial plan going forward. If I just reference page 7, which is our savings delivery in this financial year. So at the beginning of the year, we had a savings target of 7.5 million. In relation to our delivery against that, we've actually exceeded that target and we're on track to deliver 12.1 million. As a reminder, we had the additional ask of improving our position by 3.2 million on the back of the additional funding awarded in year. And that is for the increase in savings in this area. I think the key point to note is that in relation to that 12.1 million, the recurrent impact of those savings is just short of 6 million. This is important to highlight because it's part of the reason why us hitting our target control total of 12 million, how that links to our underlying deficit at 25.4 million. So the fact that we're making 6 million non-recurrently obviously continues to be a pressure going into our plan for the next year. Included in the report is the risks and opportunities that we continue to manage as we head towards the year end. There's some outstanding funding assumptions which we're expecting to be confirmed and no issue, and then a number of risks and opportunities as detailed in the paper, which we're keeping a close eye on and monitoring closely in order to help manage our position to the year end. So just in summary, we're currently £11.69 million overspent as at month 11, but holding our forecast to hit the 12 million target control total. There's still a number of risks and opportunities. I say that given that it's 20th of March, we're nearly at year end, and we continue to need to focus on them to manage to the end of the financial year. And I'll pause there, Chair, and happy to pick up on any comments or questions.
Thank you, Pete. Please do come in, colleagues, if you'd like to ask questions and so on the financial report. Ronnie, I know that this has been the subject of scrutiny and of discussion within the Delivery and Performance Committee. Perhaps you'd just give a perspective on behalf of your committee, please.
Thank you, Chair. Very happy to do so on behalf of the committee. As I've mentioned in relation to my report earlier, at its meeting in February, the committee considered the month 10 report, not month 11. But for month 10, the committee took assurance that the appropriate reporting mechanisms were in place and discussed the forecast for 24-25 and indeed the underlying deficit. And as Peter's just referenced, that remains on track to meet the control limit of 12 million. I also think it's important that I say these papers are always presented with great clarity by Pete and his team, and the committee acknowledges that in helping them to focus their discussions appropriately. During the same meeting, the committee also received a separate paper on CHC costs and undertook a deep dive into agency spend, and these clearly bear directly on the financial position. Thank you.
Thank you, Ronnie. So are there any other members, board members, that would like to contribute in response to the financial report? Please do indicate. I can't see anyone wanting to come in, so it simply remains then to Steve, please come in.
Yeah, thank you, Chair. I'm sorry for the slowness in the response. As Pete said, I mean, our two teams in particular, Finance and Commission, we work really closely to try and both understand the position and the real pressure from the Commission perspective is, as Pete said, the continuing increase in emergency activity. And we really do need to alter that profile, and it's key to one of our improvements in our 5-year plan, because if it keeps going at the current rate, you know, it's going to cost us a lot of money in the new financial year, but also it will disrupt the provision of planned care reduction, because more and more waiting lists will be cancelled and so on and so forth because of the lack of capacity and room within those district general hospitals. So yeah, we've got continued focus on that, and as the budget holder, you know, I just wanted to give the board that wider assurance of the processes that we work through with Pete's team to understand the position and the forecast out to, and also thank you.
Thank you, Steve. Okay, well, thank you. So the recommendation is that we receive the report, that we are assured by the report that we have effective financial monitoring and reporting mechanisms in place. We've received assurance from the chair of the Delivery and Performance Committee that has considered this in detail and very carefully, and therefore please indicate if you don't support the recommendation. So that is supported, thank you. And we move now to the Integrated Performance Report, month 10, and we're back with you, Steve.
Thank you, Chair. So this is the report to month 10, end of January, and the report is in a similar format and style to that previously produced. There's a very detailed performance pack and a covering paper. So just by way of exceptions from the covering paper, our own provider arm performance challenges still exist in terms of we still have some challenges in therapy services, but from the work we've done, we're expecting an improvement in the year-end forecast position for the number of breaches within therapy services. We've been holding weekly meetings with our colleagues in our Paris provider arm to ensure we, again, fully understand the position that we're in from a performance perspective, but also as the year approaches, try and improve upon the forecast year-end predictions that are included in the paper at page 6. But to note, we've still got some challenges in diagnostics and some of the consultant specialties within our provider arm. I wanted to draw out one of the mental health indicators this month, the Part 1A adult assessment, that's seen as a significant drop in performance to 28.6% at the end of January. Now that is due to a data quality issue where the team have fixed that in month, but it's caused a drop in performance, and working with the team, we are likely to see a return to near compliance when I bring the report to the next meeting. Similarly, a indicator of concern is the neurodevelopment performance, where there's the continued downward performance in that indicator, with the latest at 43.7% compliance for January. But it is the increase in referral demand and demand outstripping capacity that is causing that issue. From a commissioned perspective, we're still seeing cancer targets in our acute providers being way short of the performance standard. We discussed this comprehensively last week with the Welsh Government as part of our integrated quality and performance delivery meeting, which is part of our enhanced monitoring status. And we've agreed to do a separate deep dive piece of work with myself and Kate Wright, Medical Director, with the NHS Wales delivery team to have a look at that in more detail by tumour site and by provider, to make sure that we fully understand what is causing those delays. And if any of those delays are caused by ourselves, in terms of we may well have received the patient initially into parish provider arm and then onward referred to a tertiary centre, we need to play our role in speeding up that transfer of patient care from one provider to another. We've already heard earlier in the meeting around our A&E performance times and also the Welsh Ambulance response times within parish, and at the month 10 performance was reported at 44.1% of calls were responded in within 8 minutes, whereas the target is should be 65%. So that's a continued area of concern. As I said, on page 6 are the performance forecasts for the year end, when we are nearly at the year end, so we'll be monitoring that position really closely over the next 10 days or so. But equally, our thinking turns to the new financial year and those performance trajectories we've set ourselves in terms of the integrated delivery plan, and how quickly we return these areas of non-compliance to compliance, particularly those services that we provide. So I'll pause there, Chair, for comments and questions, and I may need to bring my executive colleagues in if there's a particular area or portfolio area that they would be better commenting upon. Thank you.
Thank you, Steve. So once again, I'll go to Ronnie because as with the financial report, this has also been considered in detail at delivery and performance. And so, Ronnie, would you like to offer a perspective, please?
Thank you, Chair. Very happy to do so. For the integrated performance report, the committee considered the month 9 report on the 29th of February. I just need to be clear about that. It was not month 10. And for month 9, the committee discussed the report in some considerable detail. And once again, we're grateful to Steve and his team for the very detailed work that they do around this to enable us to have focused discussions. We did take assurance that appropriate systems are in place to monitor performance and respond to relevant issues. I am just going to ask Steve, though, he referred to a data issue and performance, and reporting at a future meeting. Can I just be clear, Steve, please, at a future meeting of what? Is this DNP?
Yes, Ronnie, and apologies, I should have clarified that. Absolutely, and then it will come onward to board as normal. Yes.
Thank you, Chair. So I'm content for the moment.
Thank you. Kirsty, please.
Thank you, and thank you to Steve and to Ronnie, who afforded me the opportunity to raise the issue about 1A performance in mental health at DNP, but it was for the previous reporting period, I believe. So notwithstanding what Steve has said, it's a data issue. I'd like to understand a bit more what lies behind that data issue. So have we been receiving incorrect data around the performance measure previously? And now what we've got is the correct data. So I just like to understand what the data issue is and what does that mean for our previous understanding of performance, and assurances around how that data will be accurate going forward. And then on neurodiversity, I appreciate very much that demand is very, very high for that service, but we've known about this demand for about 2 years now. So initially, after the pandemic, we did wonder whether there was a rise because people hadn't been coming forward and therefore we would have a temporary increase in demand. But it's quite clear now that that service, the demand that we're seeing is kind of the level out there, which isn't going to go away anytime soon. So we've got a prolonged period now where we keep saying to ourselves, we're not meeting that target because the demand is outstripping our ability to deliver it. What is the process then for matching our ability to meet the to meet that demand, because it's not going to go away soon? And how is that prioritized amongst all the other competing pressures for resource within the organisation? Because we've been telling ourselves the same narrative for 2 years.
Thank you, Kirsty. I see, Steve, that David Farnsworth is also offering to comment. So shall I go to David first and then back to you, or would it work better the other way around?
To David, please.
Okay, thank you. Please, David.
Thank you, Chair. So just to confirm, I'll take the two questions separately. In relation to the data validation, it's been noted that one of the teams had, when recording both assessment and counselling, in the way that it was being recorded, was being picked up as part of the data, and therefore a small erroneous collection of data would have affected historical figures. Not significant, but certainly something worth separating. As a result of that, a validation exercise has been undertaken and they are breaking down all of the data to work out where we are recording and how we are recording to make sure it is being separated. This is a point in time, and unfortunately the manual process has resulted in that where the data is collected and submitted to this reporting, that validation is not complete, and therefore you will see that rather erroneous number that is shown in the report today. It is expected and reported by the team that we expect by next report, as Steve said, to DMP and obviously onwards to board, we will expect full clarification of that data, with likely outturn at somewhere around 70% in terms of compliance, and the team are working therefore on the bits that they should be improving as per the standards to get us back to 80% and the recovery plan for that, and we're fairly hopeful that that should happen shortly thereafter. So in the next couple of months you will see that return back to full compliance, and to a degree we are therefore more confident of the data. So that's that point. In relation to ND, absolutely accept your point that this has gone on for some time. The executive team have informally reviewed a business case in relation to neurodevelopment and looking at what essentially additional resources would be required to recover us. There is more work probably needed to be certain that the proposed investment would A, be achievable, and B, be sufficient to meet the level of demand. It's true to say that we've been nervous around the numbers of referrals and indeed the fact that those are converted to assessments, so we've got some more work to do to check just what those numbers are demonstrating for future growth and how we can future-proof a service. and that piece of work is ongoing currently, with an expectation that further business cases, which will also reflect our business planning, will then be submitted again. So we are expecting a bit of a plan again in the next couple of months to resolve that.
Thank you, David. Anything in addition from you, Steve?
Not on these particular points, but in terms of my introduction, I didn't mention the improvement in waiting times across Wales, which I should have, so apologies for that. So that's on slide 49, and what it records is a reduction in the long waiting patients over 104 weeks, which now stands at 190 patients. And Swansea Bay have made particular inroads into their new outpatients waiting more than 52 weeks. So we currently have no patients waiting more than 52 weeks at Swansea Bay for a new outpatient appointment, which is great progress that they've made on our behalf. But that does mean that more people that need treatment have been added to the inpatient waiting list. So it doesn't, there'll still need to be, there'll still be a treatment time associated with that wait for an actual procedure.
Thank you, Steve. Kirsty, would you like to come back in?
Thank you, and thank you very much to David for his explanation on the data point. Can I just ask for some further details then on the work that you referred to, David, in terms of neurodevelopment? You said in the coming months. Is that 2 months, 4 months, 6 months, 12 months? I'm just wondering, what is the timescale around when you envisage that work to be completed so that those new business plans can go back to execs?
Thanks, Kirsty. So just to confirm, my expectation is that the data will be reviewed in the next 2 weeks in terms of the referral data and the conversion, and then assessed against the proposed draft business plan. Realistically, I would expect a business plan to then be reviewed and go to IBG within the next 2 months, and then from that, hopefully sign off with the potential for any future investment. So I'm expecting, you know, to be able to operationally take a view in the next 2 months.
Kirsty, content?
Yeah. Yes, thank you. That's very helpful. Thank you.
Does anyone else want to come in and ask a question or make a comment in relation to the performance report? No, therefore the recommendation is that we discuss it and we note its content, but importantly that we receive the report as assurance that we have systems in place to monitor performance and to respond to relevant issues. Please indicate if, I'm sorry, Ronnie, would you like to come in?
Sorry, Chair, just by way of further contribution, in the same meeting as part of the IPR, we also discussed general medical services and community pharmacy. So I'm just mention that for reference. Thank you.
Thank you, Ronnie, which I think certainly relates to that part of the recommendation in that we take assurance that we do have the systems in place to effectively monitor performance and respond to issues. So thank you, Ronnie. Does anyone want to indicate that they don't support the recommendation? Therefore, that is once again supported. Thank you very much for that. And we move to item 4.3, the annual delivery plan for Q3. And we're staying with you, Steve. Thank you.
Yep, thank you, Chair. So as Carl said, this is the Q3 delivery performance for the current 23-24 financial year. We do normal quarterly updates to various committees and board, and this will then be onward submitted to Welsh Government also. So the production of this report is exactly the same that it has been in previous months. in terms of each of the 32 strategic priorities are reviewed for progress against plan. Each executive lead for their respective areas is involved in that process and signs off the performance position against their action or portfolio. In terms of improvement, the way we've gone about the Q3 process has been revised in terms of the planning managers taking a much more proactive role in terms of the use of what we've called pop-up sessions. So we hold short, sharp meetings with the exec colleagues to speed up the production of the formulation of the report. Following comments at DMP committee, we went back and had a look at the RAG rating for the way we report our data. So we were always using blue for complete, red behind, green, amber at risk, green on track, but we were not separating out the actions that we'd taken as a board to defer as part of our plan reset. So they were getting confused in the pie chart format. So the areas in our plan that we deprioritized earlier in the financial year are now coloured pink in action. So I'll take the report as read. It is quite detailed, right? So I'd like it to draw your attention to page 3 of the actual report itself and those pie charts. And so the bottom right hand corner summarises performance overall. And so at the end of Q3, you would expect us to be making significant progress on our plan. And so the actions that are either complete or on track together equate to just over 52% of all actions. There are 45% that are still at risk, but progress being made, and 9% that in red, in other words, that are behind schedule. And as I say, that pink section, that equates to 32%, 32 actions that we decided to deprioritize within our plan. So that represents 11% performance overall. I will ensure that the percentages are added to the pie charts in future iterations to aid that quick overview of performance. So again, Chair, I'll pause there, invite any questions or comments, but again, might need to turn to my exec colleagues in terms of contributions. Thank you.
Thank you, Steve. And just this is an illustration in and of itself in relation to the volume of stuff and the scope of stuff that goes to our DMP committee, because we're going to go back to Ronnie again and ask for a committee perspective in relation to this plan, which again has been considered by the Delivery and Performance Committee. So thank you, Ronnie.
Thank you. My general comments are as follows. We considered the Q3 report on the 29th of February. Once again, the committee discussed in detail the content of the report. And once again, we did take assurance that the Health Board has appropriate systems in place to monitor performance effectively and respond to relevant issues. I think the point that Steve has raised in relation to the confusion of RAG status is an important one, and it will be good for that to be perhaps more clear in the future. The other thing that I will say is that I'm very impressed by the ability to summarise, as it were, a plan on a page. And I think in terms of public access to documents and readability and accessibility, that's a very good principle to follow. And I'd actually like to see it rolled out further within the organisation generally, but that's a separate point. Thank you.
Thank you, Ronnie.
Thank you. Does anyone else want to come in and contribute and respond to this agenda item? Okay, thank you. I suppose, Steve, I mean, clearly, as Ronnie says, this has been looked at in detail. So, and as you have indicated, and Ronnie has supported that summary, that page summary of where we are, together with the the new pink component is really helpful. And I suppose, but I suppose that the question that is resonating in my mind now is, what does good look like? You know, as I look at that and I consider that summary, yes, we might have the systems in place. We might have those, you know, in relation to the recommendation. But how do we know that that's good enough?
Yeah, thank you, Carl, and good question. So I mean, so the items that are flagged red, so behind track, we do get a comprehensive update from directors as to why they're behind, and we also then include a delivery confidence assessment for each indicator as to how we see the outturn playing out. So that is also in the report. In terms of what good looks like overall, well, I think we need to be delivering the actions that we set out in our plan, almost without exception, and particularly moving into the new financial year because of the challenges that we face. Some of the performance challenges in year, and those indicated red, are due to recruitment delays in the main in terms of broad feedback, and so we might always have some issues around recruitment, and possibly our plan was not phased correctly to capture some of the nuances of recruitment. But I think the plan will need to be scrutinised heavily, focus on delivery, and then we will need to intervene as a board, or certainly as an exec team, if we feel that an area of our plan is significantly off, that's going to have a detriment to the wider plan.
Thank you, Stephen. Hayley wants to come in. Please do.
Yeah, thank you. I don't think it is a straightforward answer to your question about what good looks like. I think it's all the points that Stephen raised, plus two aspects I think we always need to be mindful of when we're setting an annual plan. We set it at a point in time, and with a set of information points that we've got at that time. And therefore, for me, it's about really explaining to the board our progress. And I would like to see a sea of green and we deliver everything. But there are good reasons why we, for example, last year reset some of our priorities in order to redirect capacity to deliver other risks and issues that we had to as a board. So I think it is a work in progress around how the Delivery and Performance Committee in particular has the detailed deep dive into the plan so that we're able to explain very carefully any vision changes or, you know, suggested changes to the plan, that we do that collectively as a board and we understand the rationale for it. But in an ideal world, Stephen's points were absolutely valid, but I think it's that agility and that ability to respond to in-year issues. When we set the plan last year, we didn't know about the industrial action, we didn't know about other factors, and we might face similar circumstances as we move through this year. So it's a bit of it's difficult. I don't think we can simply say it's easy to answer that question up front. I think it is about the quality of the reporting that we put in place on a regular basis through to committee and board.
Thank you, Hayley. That's really helpful, and to Steve. And I suppose what's driving my thought really is, you know, we've repeatedly said in this meeting and in lots of our discussions how important realism and deliverability is. And of course, when we then look at reports like this, you know, as you say, it's not necessarily about saying we definitely want to see a sea of green. That would be lovely, wouldn't it? And you're absolutely right, Hayley. We need to understand why. But then again, you know, when you look at that summary and only one of those boxes has got more than 50% in green, and then so I think we do need to kind of come back and challenge ourselves around that deliverability and realism space, don't we? Particularly as we've just talked about our plans for the next 5 years, and indeed the next year particularly. So, but thank you. So Kirsty, you'd like to come back in? Thank you.
Thank you. I just been reflecting on both what Steve and Hayley have said. I think the point about fleetness of foot is crucial, and the ability to adapt when circumstances change. So you can have a pretty good horizon scan, can't you, of things that might come along in the way that disrupt the plan. But there are some things that, perhaps, cannot be foreseen. I mean, the COVID being the classic example of that. But, last year, the reprioritization of money in the middle of the year, and the size of that ask, that was not evident to us. But so I think for me, it's about knowing that Steve and his team have the ability to be constantly horizon scanning and reflecting that on the risk to the plan, and then to be able to flex that plan as appropriate, and us being able to prioritize. My only concern is when you're in monitoring, get out of that monitoring, you have to be at a higher standard than what would take you in the first place. Does that make sense? Am I making sense? So it's just making sure that is part of our thinking to get us out of categorization, for a better word, monitoring status.
Yeah, I completely agree, Kirsty, just to come back in, and I'm particularly conscious, as we've called our 5-year plan our best offer, we need to hold ourselves accountable through this process and many other processes as we move forward, particularly next year when our delivery plans are firm in nature. So we will need to deliver those.
Yeah, thanks, Steve. Thank you. And actually, let me correct something as I look at these afresh. Of course, what I didn't do earlier was add the blue to the green. So actually, our performance when you add the blue and the green together is far higher than I intimated. So apologies for that.
And Chair, if I may, I mean, just to reiterate, well, not to just but to comment, we are not in enhanced monitoring for performance, so that's something that we need to maintain going forward. But I think it's important to note just that for point of clarity. Thank you.
Yeah, thank you, Steve. So I can't see that anyone else wants to contribute, so thank you for that. Thank you to the Delivery and Performance Committee for doing the detailed work around that and the assurance that has come our way from Ronnie. And so again, the recommendation is that we receive the report as a reliable source of assurance that we have the systems in place to monitor performance against our annual delivery plan. So please indicate if you don't support the recommendation. Thank you, that is supported. We turn now to the new framework in relation to speaking up safely and raising concerns, which is going to be introduced by Deborah. Thank you, Deb.
Thanks, Chair. So the board will recall that this Speaking Up Safely framework is describing a culture and environment to encourage and facilitate staff to raise concerns, and builds on existing pathways and policies but doesn't replace them. The paper within the board papers today summarises the progress that has been made on the Speaking Up Safely framework following our previous self-assessment, and that update is set out in Appendix 2. If I could just give my thanks to those involved in that Speaking Up Safely group, particularly staff side and the Chat to Change network. One of those important pathways is the All Wales procedure for NHS staff to raise concerns, and the Health Board adopted that procedure in October 2023. However, in order to strengthen the raising concerns procedure, the board is being asked to adopt a supporting policy statement, which is within the cover report and also in Appendix 1. I should point out that within the cover paper there is an extract of the data on raising concerns responses to the question in the most recent National NHS Staff Survey. To note, we've only had the headline data from the staff survey, and we expect to receive that full data set in April. When we do receive that, that will be a subject to a separate report and triangulation of all data to set up an action plan, which will then be brought through to Executive Committee, Workforce and Culture Committee, Local Partnership Forum, etc., setting out how we will focus on those areas requiring more attention and how we'll monitor that. And I'll pause there and happy to take any questions. Thank you.
Thank you, Deborah. And Ian, please.
Yes, thank you. Welcome this really important source of information that our staff are able to tell us what it's like, because sometimes it's difficult from a distance, and I wanted to recognise all the work going on, as I may have mentioned earlier. Just one small point of accuracy in 4.4b, it references the joint PQ, Patient Equality and Workforce and Culture Group. That was held in 23, but it says 24 in the report. Just a small matter of accuracy.
Thank you, Ian. And Ronnie would like to comment. Thank you, Ronnie.
Thank you. Just to make a general comment, against the background of staffing pressures generally and turnover within the NHS, I think it's really important that this issue is taken seriously and that the rights of individuals who raise concerns are properly protected. So, Deborah, I'd be really grateful to know if someone does raise an issue specifically and practically, and I guess it depends to an extent where they are in the organisation, but specifically and practically, what support can they hope to gain when they report a situation like this? Thank you.
Thank you. Would you like me to? I'll
yes.
respond.
Yes, please do.
It's a really important question, Ronnie, so thank you for raising it. Within the Speaking Up Safely framework, there's a whole flow chart which kind of directs individuals. So if it was a safeguarding matter, where somebody would need to go with that. If it was a matter relating to fraud, the route that they would need to take, in addition to respect and resolution, etc. Clearly, individuals sometimes will raise those with their line manager, and that is resolved. But they may choose to access wider groups such as trade unions, such as workforce and OD colleagues, in order to test that out in a safe space. So we definitely provide that sort of support arrangement for those that might actually be worried about bringing forward something, in order that that they feel that the environment is open enough that we can hear comments, and we will support individuals to raise them. One of the areas within the Speaking Up Safely group is to also try to simplify and clarify that, and hopefully you will have seen in the action plan reference to Our Voice, which will provide a portal for individuals to kind of properly understand and actually be reassured that they will be supported through those various channels that I've just summarised, should they choose to come forward with a concern, whether that's about something in their workplace or something that they see anywhere else across the organisation.
You content, Ronnie? Would you like to come back, or are you okay?
Thank you, I'm content.
Thank you. And Hayley, please come in.
Yeah, thank you. Just reiterating Ronnie's points about how much I welcome this report, but also for us as a board, you know, setting the right tone and culture, so that we're sort of modelling that open space and making our staff and members of the teams feel able to approach us and to get the implementation of this reassurance in the mechanisms that we've already got through our line managers, but also in the day-to-day contact that we have as we go about our general business and visiting sites. I think the point that Deb said about the initial staff survey results and how we bring these elements together, but particularly the role of the staff side partnership forum and the work that we do in partnership there is going to be very important to get this fully implemented in a way. Again, it's a similar point to the earlier one about the improving quality performance framework changes. It is partly about reassurance, but also the visibility of this across the whole organisation. So I think the communication and reinforcement of those messages in our day-to-day work is going to be very important to reassure staff that we are really taking this seriously, and there's no such thing as bad feedback. All feedback is fine. We just need people to feel safe to speak up. Thanks.
Thank you, Hayley. Does anyone else want to contribute to this paper, to this agenda discussion? So as Hayley has just eloquently said, a really, really important matter, and as an organisation, as a board, we certainly want to do and committed to doing everything within our capability to make sure that principles of transparency, openness, candour, frankness, and so on are part of the how we do things. Yes, with staff, but also with patients and people, and crucially important. And things go very, very wrong when things are not like that. So thank you, Deborah, for bringing this, and we are asked today to note the progress in relation to the framework and to approve the policy adoption statement and the revised All Wales procedure for NHS staff to raise concerns. Does anyone want to indicate that they don't support the recommendation? So that too is supported. Thank you very much. We move on to item 4.5 and the Health and Safety Annual Report. Our Executive Director, Claire Madsen, will introduce this, and I can see that Jason Crowell has joined us as well, who will contribute to this agenda item. So first to you, Claire. Thank you.
Thank you, Chair. Thank you, Chair. Yes, happy to bring the Health and Safety Annual Report to the board today for committee. For assurance. I just wanted to note that this report was considered and given assurance at the DMP committee on the 29th of February previously, and I think just wanted to pick out 4 key issues with the report, really. Just to note that we've had no health and safety executive enforcements in the last 12 months. We note that we have some key challenges around training, but we note that there has been improvement in this work and that there is a plan for the following year to address that issue. We have strengthened the governance and reporting of the health and safety work via the Workforce and Culture Committee and the Patient Experience and Quality and Safety Committee, and we also now have the annual report coming to this board. And lastly, we've had positive assurance from the internal audit on the work of the Health and Safety Group and the policy framework surrounding this work. So I won't say any more on the paper, but both Jason and I are happy to answer any questions.
Thank you, Claire. So once again, we will go to Ronnie. As you said, Claire, this was the subject of attention by the Delivery and Performance Committee. Also, Claire, you did mention its connections with PECS and Workforce and Culture. So if Kirsty and or Ian had a comment or wanted to come in on this, then please do. But first to you, Ronnie.
Thank you, Chair. As Jason knows, I went through this report pretty thoroughly at Delivery and Performance, And in fact, people might generally expect that because it reflects an area of my professional interest. But can I just say that I very much welcome this submission of the annual report. I welcome its detail, and I welcome the extent to which it has been prepared as a thoroughly well-presented document. I'm just going to pick up on a couple of comments that you made, Claire, and that is, as you quite correctly say, there's been no PHSE involvement either through FFI or through formal health and safety executive inspection either. But in a sense, by the time either of those happen, you know you've got a problem. And so what we need to do is to build systems around this in order to minimize the potential for that sort of interaction to occur. And I think you've laid emphasis on the fact that there are some areas of training that are required, and I would expect that. But I think it is important that those areas of training are followed through comprehensively in order to proof us, if you like, against the need for any formal intervention. But I do very much welcome the annual report, and I welcome its detail. And as I say, I commend it as a document. Thank you.
Thank you. Kirsty and Ian have indicated there are no additional comments from the perspective of their committees today. Claire, Jason, do you have anything else that you'd like to add in response to Ronnie's observation, or indeed anything else in summary?
No, just to say it was really helpful, the feedback that we had from the committee to help us strengthen the content of the report and to strengthen the work that we'll do in the work plan for the coming year. So just thank you to the committee for their support and advice, really. It's been really helpful.
Thank you. Okay, well, today then, as regards the Health and Safety Annual Report, we're asked to note that the Delivery and Performance Committee, as we have heard, scrutinised the report at its meeting on the 29th of February and took assurance from it. And we're also asked to receive ourselves and to take our own assurance that our organisation implemented our Health and Safety 2022-23 work plan, and it's implementing the programme for 2024. So please indicate if you are not content to support that recommendation. Once again, that is supported unanimously. Thank you, Claire, thank you, Jason, and thank you, Ronnie, to you and your committee for the work. As you said, we've come to you several times now, which I think is illustrative of the important work that that committee does. We turn our attention now to the Socio-Economic Duty Assurance Report, and Mererid, you're going to introduce this. Thank you.
Okay, diolch yn fawr. So I'm pleased today to be presenting this paper to the board to provide an update on the socio-economic duty and to provide assurance about the Health Board's compliance with it. So the duty places a legal responsibility on the Health Board to have due regard to the need to reduce the inequalities of outcome resulting from socio-economic disadvantage when the board takes strategic decisions. So the paper has previously been considered at Planning, Partnerships and Population Health Committee, and you'll see from the paper that it provides a range of examples to show some of the ways in which the Health Board has applied the duty and how it complies with the duty. So within the report also included reference to a toolkit that's been developed to support organisations to embed the duty within its work. And public bodies are encouraged to look at how they think, act and deliver services to the most deprived groups. So by the nature of this Act, this will require ongoing work across the organisation, and if you build on the firm foundations and good progress that has been made. I just want to acknowledge that this is across organisations, and colleagues, exec colleagues have also been contributing to this work to embed it across the departments. Diolch.
Diolch yn fawr, Mererid. And so this particular report, again, has been scrutinised in detail within our Planning, Partnerships and Public Health Committee. Robert, over to you for a perspective from that committee. Thank you.
Thank you. The committee believe that it is our actions that provide evidence that we are implementing this duty. We noted the adoption of quality impact assessment templates, and also that the duty is linked with the Health Board's strategic equality plan. We examined case studies, including the closure of a GP surgery and the response to differing vaccine take-ups. In conclusion, I can confirm that the Population Planning and Partnerships Committee gained assurance from the evidence contained in this report. Thank you.
Thank you, Robert. Does anyone want to respond to this report, to Mererid and her introduction of the report, or indeed to Robert and his committee perspective? No, so thank you for that. In which case we go to the recommendation, and we are asked to note the Planning, Partnerships and Population Health Committee that committee has received and took assurance from the report at its meeting on the 20th of February. And we also take our own board assurance as regards our compliance with the socio-economic duty. Does anyone not support that recommendation? In which case, we support that unanimously, and thank you, Mez, thank you, Robert, and to your committee colleagues. And so we go now to our next item. I'm not sure that Helen, is Helen back with us, or Hayley, will you?
I'll pick it up, Carl.
Okay,
yeah,
there we are.
I'll pick it up. Helen unfortunately hasn't been able to return to the meeting yet, so I'm happy to take this report. So this is the latest version of our corporate risk register, last updated in February. It sort of we feel it's a current reflection of our current risks, and in particular there are two risks relating to cybersecurity and power outage, which we will discuss in committee due to the confidential nature of its content. In relation to couple of things to highlight really is that, you know, clearly we've earlier today just considered our plan for next year, so we will be needing to ensure that the corporate risk register is updated in line with the 5-year plan, and that work will now progress over the next few weeks. And also, just to make the connection from the last Audit Assurance Committee, we had a discussion about the work that Helen and the team are leading as well in updating our board assurance framework. So both those elements will be updated in line with the plan that we've discussed earlier today. So I wasn't going to say any more other than open it up to comments or questions. Thanks.
Thank you, Hayley. Are there any comments or questions? Thank you. So, well, before I come to the recommendation, Hayley, just picking up on your last point, because as board members, of course, we had the pleasure, I think, of a very interesting and a very important board development session on risk management. And one of the important matters that came from that session, I think, was how crucial it is to link both risk appetite and risk management with strategic priorities. So I suppose what I'm coming to is the point that you were making about the further development, just to make sure that my understanding is that links with what we learned in that session.
It certainly does, and the quality of that session that we had as a board has also been recently undertaken with the risk management group in the organisation, because we need to see this operating at across all levels of the organisation. But absolutely that we've set now a strategic plan for the next 5 years, so we'll need to recast and check our corporate risk register against those strategic objectives and bring that back to the board for approval, alongside the comments within our structured assessment report around the need to consolidate and pull the various components which we've already got, but we haven't pulled it under the framework of a board assurance framework, and those two aspects we do need to get in place early in the well, probably April-May time, I think. I'm not quite sure of the time scale, Carl, but soon we'll be bringing those back for consideration.
Thank you very much. So I'll just pause slightly in case anybody else wants to contribute to this agenda item. Doesn't seem that anyone does, so we consider the recommendation that we receive the February 24 version of the Corporate Risk Register, including in Appendix 1, ensuring that it's a complete and true reflection of the Health Board's current high-level risks, and recognising that a broader review of the organisation's risks is currently underway. And we note that the details of the specific CRR 009 risk will be reported and discussed in our in-committee meeting later today. So once again, does anyone want to indicate that they don't support the recommendation? In which case that's supported unanimously. Thank you. Good as always to have Katie with us, the Regional Director of Llais, already made important contributions to our meeting today. But thank you, Katie, for your report as always, and over to you. Thank you.
Diolch, Carl. I'm conscious that whilst you've chaired this brilliantly and you're ahead of the scheduling, it's been a long meeting and I'm last on that agenda, so I'm just going to sort of...
But not least, Katie.
No.
Absolutely.
No. But you've got other meetings as well, so I'm just going to keep it very brief and simple. I'm hoping the report is self-explanatory. I have to just make a couple of observations. The hyper-local approach that we're adopting at the moment is proving to be a huge success, and I know I think as an outcome of the last meeting, I've had a conversation with Claire and her team and how we can work closely together, and also met with Pavo as well as to how we can work more closely together. And I think you can see from the figures that are within that report that we are listening and hearing from significantly more people than we ever did when we were the Community Health Council. So as a model, I think it's really effective. I think, as I shared at the last meeting, after each event and after the report's written, we're putting together key sort of stakeholders, decision makers from both the local authority, the health board, Pavo and the community to actually work through the report that's been produced and to pull together some sort of an action plan is a little bit sort of formalised, but an agreed way forward that we can all take and respond to the issues or some of the issues that have been raised by that particular community. I think the only other thing really that I draw your attention to, I have included a little video for you. I hope you can manage to access that. We're trying in Llais to move away from having rather lengthy, long, wordy reports, and so we're looking at other means of communicating. We're looking at using artificial intelligence. We've just commissioned some work from licenses from a company called Synthesia, so we're producing that. So we're at some point you will get a report to your board that isn't written, that it'll be some sort of interactive report. So I just think we're trying to move away from that. And I have also included for you a newsletter that we've sent out, and similarly, again, trying to make that a little bit more dynamic and interesting rather than the more traditional newsletter focus. So any feedback on any of those would be greatly appreciated. And I suppose finally, well, not suppose, sorry, finally, just to congratulate Hayley publicly on her appointment as Chief Executive Officer, and we look forward to continuing working with you. And if Nina is still on the call, to take this opportunity to publicly congratulate her on her appointment too. So that's it from me, Carl. I'm very happy to take any questions or comments that members might have.
Thank you, Katie. And I know that we said this last time, but certainly in the conversations that Hayley and I have been in with the Chair and Chief Exec of Llais Wales, as it were, you are forging ahead and in a very innovative way with that micro approach to engagement and to listening, and that's something that we know is being picked up as a model of good practice elsewhere. So I absolutely acknowledge that, and yeah, really interested in your different approaches to reporting and to so I think we'll certainly be looking at what can we learn from you. Because that might it could be a very refreshing shock to the system, if I can put it like that. So thank you for that. Does anyone want to comment or respond to Katie's report? I can't see anything that anyone wants to say anything specific. Sorry, yes, Chris, please come in.
Thank you, Chair. Sorry, trying to type not quickly enough to get the question down. Katie, thank you for the report. It's not really a question, well, partly a question. What I notice is that a lot of the themes that you're picking up on are very similar to what I hear, and I don't know if that's reassurance or a bit scary in that sense that it's the same issues around dental access, GP, distance of travel, and social work. I hear those on a fairly regular basis coming through. Do you notice a difference when you're looking at it from the health board's perspective compared to looking at it from the county council's perspective when you're doing those consultations with public?
With regard to the theme, with the sort of themes that are coming through first, Chris, yeah, there definitely are. But I think one of the reasons we adopted this approach was because before we were doing it across powers, and of course there are very different, as we all know, very different pathways across powers and very different issues, and different formats of accessing services. So we felt that doing it locally would be more effective. So yeah, I mean, there are, there continue to be, and I chat with the health board, there do continue to be issues around accessing NHS dental appointments, not unique to Powys, I hasten to add. It's an all Wales challenge, and similarly the GP access, although I think the GP access it's been interesting doing it on a localized basis, because it's not as consistent an issue across the whole of Powys. I think that would be fair to say. There are some pockets where actually we've received some very, very positive feedback, and I think that's one of the benefits of doing it this way, from the point of view of actually being able to pick up positive feedback as well as issues and concerns that people have. With regard to the health and then the social care dimension, I mean, obviously social care is new to place, and we're still working our way through it. And what we're trying to do is to be the sort of conduit between the two, which is where the stakeholder meeting actually becomes a very useful discussion to have Nina and her team around the table, and Adrian and Hayley's team around the table, and we can have those joined up discussions. At the moment, I mean, there doesn't appear to be anything that's particularly different to what you would expect. We've identified an issue around the isolation of carers, and the support for carers, both adult and young carers, but we're picking that up, and that's obviously something that crosses both health and social care. So it's about trying to make those connections, I think. And yeah, any suggestions or any thoughts as to how we might improve on that, then please do drop me a note.
Thank you, Katie. Chris, you content?
Yes, I'm content for now. Yes, thank you, Chair. And I mean, it's something that I think the local authority perspective we also need to consider and work with LICE to how we can get a system that works in both interests, and then cross over with the health board as well.
Chair, do you mind if I just quickly pop back in on that comment, because I just want to provide assurance really to Chris that I meet Nina every fortnight. I didn't meet her last night because there was quite a lot going on last night with other things, but I meet Nina every fortnight. I'm meeting Emma tomorrow. I've presented to scrutiny committee, so we're just trying to, and cabinet, and to a development day of councillors. So we're just trying to work through the governance, the different governance arrangements with the local authority, whereas they're being quite established, obviously, with the health board for quite a number of years. So I just want to provide you with that assurance that we want to make sure that this report, for example, that I share with the health board, and it's in the public domain, I also share with Nina, and that we need to make sure that goes to scrutiny committee, but those sorts of things we're working our way through. So just that assurance really.
Okay, thank you. And I can see that Nina was going to come in, but I think, Nina, you were going to make an almost identical point. So Katie's made it for you. So thank you. And well, thank you, Katie. I suppose from my perspective, I just wanted to give you an opportunity to say, I mean, clearly, as a board, we are committed to listening, to learning, and to putting that learning into practice. And you've mentioned the ways in which you have very regular, frequent, substantial engagement with officers and so on. But are you content with the way in which we listen, learn, and implement improvement?
I am, and I think it's really important, Chair, to recognise that, we all know that there are challenging times ahead, and part of those ongoing conversations is about, during that period, how the voice of the communities and the individuals can be listened to, heard and taken on board. But I'm confident, both with the local authority and the health board in Powys, that we've got those structures and that maturity to be able to have difficult conversations, because there will be difficult conversations, but to make sure, I think all of us have got the needs of the communities and the individuals of Powys at the centre of all we do. So I feel very fortunate, actually, that I've got that working relationship with colleagues in both the health board and the local authority.
Well, that good fortune works both ways. So thank you for that. OK, so as always, we receive with gratitude the LICE report, and we move now to the new bit on our agenda, which is the consent agenda. Ian earlier indicated that he would like to bring. Helen or Ian, please step in if I get this if I get this wrong. But my understanding is that we want to, if you like, remove item 5.2 from the consent section, and so. But items 5.1 and 5.3 remain in the consent section. So let's deal with 5.2 first. Hayley, do you have initially any comments that you want to make about about this item?
Not particularly. I'm happy to go straight to a question.
Okay, Ian, please come in.
Yeah, thanks very much for this. I mean, the first thing I want to say is obviously I welcome this approach. We've heard a lot about partnership work, and we heard it in the last report. We heard it certainly when we started to talk earlier about our five-year plan. So vitally important, and clearly working together with the local authorities is a crucial part of that. I think for me though, I didn't want to let this go without providing Hayley or Nina. It's great to see Nina in the meeting has been recognised earlier on. And for me, when I looked at the terms of reference, this is something that I've said earlier, but I think it's worthy of note. They're great and laudable aims in terms of the terms of reference, but I'm minded of the I'll say this briefly. Let's call it the unprecedented pressures on public services generally at the moment. We've not seen anything like it, and so for me, I do have a question in my mind about whether those terms of reference lack some urgency in terms of action. So I just wanted to provide Hayley and or Nina as appropriate the opportunity to come back on that.
Can I just be clear, Ian? So we have 3 different sets of terms of reference within this agenda item. Are you speaking generally about all 3?
I'm talking about the joint leadership team and the board and cabinet, so the joint working between our 2 organisations, the local authority specifically. Okay. And I guess just to say a little bit more, I've no wish to alter them, but it would be good to hear where we are in terms of our commitment to more than the words on the paper.
Thank you. So I go to Hayley and Nina for a response, please. Hayley first.
Yeah, thank you. Thanks, Ian, for that comment. And I think that it might be helpful to reflect, we have had several meetings of the joint leadership team, but also a fairly recent meeting of the board to cabinet, where I think we had the opportunity to both explore our commitment to this work, but also the urgency. We're on a burning platform in terms of public service pressures, the demographic changes, and the ways in which we need to work in partnership to continue to serve the population of Powys as best we can. And so I think the response to giving you some sort of sense of assurance around this is that the board to cabinet, which holds us to account, set a really, really clear direction about this is important and it is urgent, and we have got to work together as a whole system with other partners as well, because we recognise that one decision that one organisation makes could have an impact on another. And secondly, that if any one part of the system is failing or having difficulties, that has a massive interdependency and impact on another. So I think that commitment has been in place if we were to review, and we can think about how we bring this reporting through to board in the discussions that we had. But I think it's the work programme that we agree, and being able to demonstrate that. And at the last meeting, we did agree that we would pull together that work programme as a matter of urgency and pace in order to give you further assurances that the work programme is in line with the ambition that we've set to work in partnership. So I hope that's okay, Ian, as an initial response, but I'm sure Nina will want to come in. Thanks.
Please, Nina.
Thank you, Chair, and thank you, Ian, for the question as well. And just want to kind of follow on from what Hayley said there to kind of, provide assurance and commitment from the local authority to working together with Powys Teaching Health Board as a key partner, but also wider partners and stakeholders as well. We all as a public sector facing very significant challenges, and the only way we're going to find, address those challenges and get solutions is by working together to a whole system kind of approach. So just wanted to provide kind of assurance and commitment around that. Yes, it's ambitious. Yes, there's a lot of work to do, but I think we've made a really good start and progress. The joint leadership meetings, I think, are really working well and already kind of delivering positive outcomes and improvements across our kind of area working. So just wanted to provide a little bit of assurance for you and follow on from what Hayley has said. Thank you.
Thank you, and perhaps just from me as well, just to add to that, the leader of the council and I meet for a one-to-one very regularly. We also meet informally as both the leader and deputy leader and the chief exec and us from ourselves, Kirsty, myself, and Hayley. We meet informally regularly, and both within those informal and formal relationships and working commitments, there is definitely a desire, an appetite, and a commitment to develop further that, as you say, Ian, very, very crucial, important working relationship. And actually, it's what our population expects of us, and it's only what our population deserves. And so we're very, very committed to that. And I'm very, very hopeful that the new arrangements will serve that better than perhaps the previous arrangements. But with that, Ian, would you like to come back on any of that?
No, that it's really good to hear that, and it's really good to hear that from all three of you. And I look forward to what is going to be a significant, a substantial piece of work. And partnership working is never easy. It's difficult to go ahead at pace. Is it much easier to go alone quickly, isn't it? But if we're going to go far, we're going to need to go together, as the saying goes. So thank you very much for your comments.
Thank you. So if there are no other comments in relation to item 5.2, the recommendation in relation to the board partnership arrangements is that we receive and note the updates contained in the report in respect of matters discussed and agreed at partnership board meetings. So I'll assume that everyone supports that recommendation unless you'd like to indicate to the contrary. That is supported. And so items 5.1 and 5.3 we deal with under the consent agenda. I'll just read the recommendations. I won't open it for discussion, and I will therefore assume that the recommendations are supported. So 5.1, assurance report of the board's joint committees. We note the updates contained in this report in respect of the matters discussed and agreed at recent joint committee meetings. Item 5.3, the assurance report of the board's local partnership forum, and that we receive and discuss the update report appended to this report. We haven't discussed it per se, but because we've decided to manage it and to receive it under the auspices of our new consent agenda approach. So given that, I'm not aware of any other business that needs our attention today. Therefore, that concludes and closes the business of our meeting. It just remains for me to say a huge thank you to everyone who has prepared for today and provided the information, the data, the papers and so on that we have needed in order to transact the business of today. There was a lot to get through, but I think as comments have the comments that have been made during the meeting is that there is high appreciation for the quality of information and for the accessibility of the information that is provided to us. And I just do want to reiterate as well our thanks to the important work that is carried out in our committees, and we hopefully have seen how that plays through into providing assurance to us as a board that our important work of scrutiny and monitoring is happening effectively. And so thank you for all of that. We now have an in-committee meeting in a short while. The date of our next meeting is the 22nd of May. But for now, am rwan, dwi jyst am ddiolch I bob un ohonoch chi am eich cyfraniadau ac am y gwaith paratoi sydd wedi mynd mewn wrth cynllunio ar gyfer y cyfarfod heddiw. Dyn ni'n gwerthfawrogi pob dim. Thank you so much. Good to be with you, and look forward to seeing you before too long. Thank you.